Hello, hello, hello class. Magandang hapon po sa ating lahat. So tayo po ay magkakaroon ng lecture about CD. Pasensya po na late po ang lola niyo. Okay, so may binili lang ako tapos medyo na late ako pabalik. Okay, so magandang hapon po sa ating lahat. Pwede po ba mag-chat muna tayo kung ano pong license ang gusto niyong kuning class? I-chat natin kung ano po kayo. HAAD, USRN, or UKBT po. Good afternoon, everyone. Ayan po, mga USRN po, karamihan. Ayan. Okay, HAAD, RN, USRN, US citizen. May US. Okay, dapat doon ka sa may embassy. Kasi US citizen. Okay, so yon. Australia, USRN. Mo, dalawa. HAAD and USRN po. Okay, Canadian RN. Okay, so magandang hapon po sa ating lahat ngayon. Tama? So tayo po ay magkakaroon ng discussion ng tinatawag class na Communicable Disease class. No? So yon. Okay, so we have here what we call class what? Okay, start muna tayo class sa ating discussion for CD. Ayan. Ready na ba ang lahat? Okay, so yon. Pag ready na, let's start. We have what we call as your communicable disease. Ngayong sa kukuha na itong October, November, medyo madami-dami ang mga lumalabas na communicable disease. Ano itong number 1? Sino makakahula ng number 1 na communicable disease na lumalabas ngayon? Sino makakahula ng number 1 na communicable disease na lumalabas ngayon? Ang number 1 na communicable disease na lumalabas ngayon ang tamang sagot ay measles. Tama? Measles. Top 2, sino? Meningitis. Top 2, meningitis. Tama? Sir, may you use English please? Ay, okay. From what country? Miss Pamela. May you use English please? From what country? Miss Pamela. Pamela, 1. Okay, so yon. From what country? Zimbabwe. Hello. Okay, so yon. How did you know top rank? How did you know top rank, Miss Pamela? How did you know top rank? From my school. What is your school? What is your school, Pamela? Adventist. You're from Adventist University. Hello po, Miss Pamela. Okay, so let's start, no? Okay, so yon. Okay, we have here what we call as your communicable disease class. Okay, so yon. So for communicable disease, okay, so it is a disease that can be transmitted from one person to another. Okay, basta ang isang sakit can be transmitted from one person to another. Okay, we call that as what we call as your communicable disease. So how would you know that a particular disease is said to be communicable? A disease is communicable if it has what we call as what? Your causative agent. If the disease has what we call as causative agent, then I would call that as what we call as your communicable disease class na tinatawag. Okay, so communicable disease is a disease that can be transmitted from one person to another. Okay, so how would you know that? There is what we call as what? Causative agent. If there's causative agent, then that is communicable. Question, is hypertension communicable? Question, is hypertension communicable? Yes or no? Yes or no? No, it is not communicable. Why is it not communicable? Because there is no what we call as what? Causative agent. Because there is no causative agent. That's why it is not communicable. Tama? There's no causative agent. What about last? When I say class your pertussis. Pertussis. Is pertussis last communicable? Yes or no? Yes. Pertussis is communicable because it has what we call as what? Causative agent. Because it has what we call what? Causative agent last. Okay? So yun. So when you talk about what we call your immunity na tinatawag, okay? So that's one of the important concept. By the way ha, the concept is what? Kadugtong nito yung safety and infection control. By the way, was I able to discuss immunity when I discuss safety and infection control? Was I able to discuss, okay, was I able to discuss, not yet, immunity? Not yet. Okay, very good. So it's time to discuss now immunity, transmission-based precaution, which are very important in the exam, contact airborne droplet, not yet also. Okay, so yon. So we will discuss this in our topic today. Immunity. How would you know that a particular person is immune against a specific disease? If a person class is immune against a specific disease, that person is said to be what we call class what? Resistant. That person is said to be what we call class resistant. So if you are resistant, what does it mean? It means that you have a lot of antibodies. If you are resistant, it means that you have a lot of antibodies. So there are two important terms no, that you should know. The two important terms that you should know is the term antigen and the other one is the term antibodies. Okay, so these are the two basic terms that you should know. The term antigen and the term antibodies. When you say what we call class antigen, how do you define class antigen? Antigen are best defined as what we call class what? Okay, antigen are best defined as foreign bodies last. Yes, antigen are best defined as what we call what? Foreign bodies class. Yes. When I say class foreign bodies, it has something to do with what? Microorganism. It has something to do with what we call class microorganism. So when I say class antigen, it can be what we call class what? It can be what we call as your bacteria. It can be a bacteria. It can be what we call a virus, a protozoa, a parasite. Tama? And it can also be the toxins no, that is released by the microorganism. Tama? Now, are there toxins last that the microorganism release? Yes or no? Yes, no, there are toxins, no, that are released by microorganism, and they are also considered as what? Antigen. Okay, your typhoid releases toxins. Your tetanus releases toxins. Tama? Your syphilis, you may sometimes encounter syphilis. Syphilis, okay, also has toxins. Okay? So these are all antigen. Sa Tagalog, our antigen are kalaban or kakampi. Okay, sa Tagalog, are antigen, kalaban, or kakampi. Okay, so yon. So ito class ay kakampi. Okay, ay kakampi or kalaban? Kalaban. I'm so sorry. Tagalog konyo din na. Konyo din Tagalog ko. Ngayon, okay, antigen or kalaban. What about class? When I say class, antibodies. When you talk about class antibodies, how do you define what is antibodies? Antibodies class, they are said to be protein. No, antibodies are said to be what we call class your protein, but this protein are what yan. They are said to be what we call class your protein. So this protein, okay, what do they do? This protein class, they will destroy a familiar antigen. Okay? They will destroy familiar antigen. So how do you define antibodies? Antibodies are just like armies. Tama na so yun. Since they are what we call as armies, once they see terrorists, fire ako! Tama? So that is what we call antibodies. Antibodies are the one who kill familiar antigen. Tama? So that is the explanation why when you have what we call class chickenpox, ilang beses ka lang nagka-chickenpox? How many times can you have chickenpox in your life? You can only have chickenpox once in your life class. Tama? Very good, Miss Umali. Okay, once you already have chicken pox already, for example, who among you here, okay, already had chicken pox? Who among you here already had chicken pox? If you have what we call cluster chicken pox, for example, Miss Shoko. Miss Shoko already had chicken pox. Since Miss Shoko already have chicken pox, it means that Miss Shoko has what we call cluster what antibodies already. So once Miss Shoko has what we call cluster antibodies body already, let's try to check class what we call class your chicken pox virus. Tama? Okay, we have what we call class the chicken pox virus. Let's try to check the appearance of what we call class your chickenpox virus. Okay, so this is what we call class. Oh my God. Okay, example. This is what we call class your chickenpox virus. You see that? Okay, that is what we call class your chickenpox virus. Can you see that? Now, that chickenpox virus, okay, for example, a child has what we call chickenpox, and the child, okay, transmit chickenpox to you. Question, which is common in your examination. What is the mode of transmission of chickenpox? What is the mode of transmission of chickenpox? The mode of transmission of chickenpox is via what we call class what? What is less the mode of transmission? The mode of transmission is what we call class your airborne droplet class na tinatawag. The mode of transmission is airborne droplet. And aside from airborne droplet, chickenpox can also be transmitted via what we call class your what? Contact transmission. Chickenpox can also be transmitted via contact transmission. So can you get chickenpox through skin to skin contact class? Yes or no? Yes. You can get chickenpox via what we call class your skin to skin transmission. Tama? You can get chickenpox via a skin to skin transmission. I'm sorry. I am sorry. Okay? I'm sorry. Okay, sorry for that accident. Okay, now, so if this chickenpox virus would enter, okay, through Miss Shoko's body, example, this is the body of Miss Shoko. Okay, so yon, the chickenpox virus would enter Miss Shoko's body. Now, the virus is very big. Oh my God, it's bigger than the head. No, it's a tumor already. That's not a virus, that's a tumor. Okay, yan. Okay, let's check. The chickenpox virus is already there inside the body class. Can it harm us? Can it harm us? Yes or no? No. Because antibody, what would it do? It would destroy familiar antigen. So the antibodies would attack the virus. Bratatatat, 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 bratatatat. Fire a hole. Then the virus would, okay, would disappear. The virus is officially dead. Alright, so yun. So you will not have chickenpox anymore. So that is the explanation. Once you have chickenpox, you cannot have chickenpox again. Tama, no? So yun. Question, what about when I say class flu or trangkaso? Once you have flu or trangkaso, can you have flu again? Yes or no? Once you have flu or trangkaso, can you have flu again? The answer, class, is yes, because flu virus are of different strains. So I say different strain, it constantly mutate into another type of virus. So that's why ang antibodies, okay, cannot already remember kasi parang kamukha lang. Pero hindi yan eh. Kamukha lang yan siya. Tama na, so yun. So that is the explanation why when you talk about the flu vaccine, how often should you have your flu vaccine? How often should you have your flu vaccine? You need to have your flu vaccine yearly. Okay? Yearly, because the virus is mutating. In short, the flu vaccine that you give this year is only effective for this year. That flu vaccine is not already effective next year because the virus has a new appearance now. Okay? Not now, next year. The virus has a new appearance next year. Tama? So that's the explanation. So we have what we call class what? We have what we call class antigen, and we have what we call class what? Antibodies class. Do you understand? Okay, so we have the term antigen and we have the term antibodies class. Okay, so yon. So when I say class antigen and antibodies, these are two important terms. Okay, so let's talk about what we call class immunity. Okay, very important, okay? In your examination, understand this. If a person is immune, then most likely the person is resistant. If the person is resistant, it means that the person had a lot of antibodies. The person had a lot of antibodies. Now, class, listen to this. There are two general types of immunity that we have. The two general types of immunity that we have what we call class what? Natural immunity, and we have what we call class what? Acquired immunity. So these are the two general types of immunity. The natural and the other one is what we call class what? Acquired immunity. So when I say class your natural immunity, it is an immunity that is said to be what? It is an immunity that is said to be what? Inherent in the body. Immunity that is said to be what? Inherent in the body. So when I say class inherent in the body, nung pinanganak ka, immune ka na, you will not get sick of this already. You will not get sick of this already. This is what we call class your species is specific. This is what we call what is species is specific. So there are diseases less which cannot affect human. There are diseases which cannot affect human class, no? And there are also diseases which can affect us human class, no? So yon. So what are example, no, of diseases that cannot affect human? Example of diseases that cannot affect human, we have what we call class what? Your parvovirus of the dogs. The parvovirus of the dogs class, they cannot cause disease to human. Parvovirus among dogs, they cannot cause disease for human class. No? So yon. Because why? We humans are naturally immune to your parvovirus. Okay? We are naturally immune. In short, who among you here, okay, had already a dog that, sino may aso dito nagka-parvovirus sa inyo? Sino dito may aso nagka-parvovirus? The dog has parvovirus. May ba dito? Okay, so yon. If the dog has parvovirus, for example, you have a dog, it is a parvovirus test. You touch the dog. Oh, the doggy. Oh, come on, doggy. Hug me, doggy. You're so cute, doggy, doggy. Okay, so question. Now, once you come in contact with the dog, can you get parvovirus? Do you have parvovirus? No, because that is only specific to what we call as what? Your dogs. Tama? Diseases of animals are different from diseases of human. That's why when you get sick, you go to the doctor. When animals get sick, they go to the veterinarian. If only that human and animals have one diseases, then basically you have one hospital. Now, when you go to the clinic, when you queue up in the line, okay, you have there in front of you some animals like your raccoon. At the back, there's an alligator at the back. And far back, there's a giraffe there. Okay, so yon. Why? Because you have same disease. But again, no, there are some diseases which are different for animals that it cannot harm us. What do you call that diseases that cannot harm us? Those are naturally immune diseases. No, those are naturally immune disease. But question, no, how many microorganism? How many microorganism do we have class in our what? Okay, how many microorganism are there in the world? Okay, if you're asked how many microorganism exist, oh my God, it's a trillion species. There are trillion species of microorganism in the world. And out of the trillion plus, no, so yon, which can affect disease to humans. No, so yon, how many organism can affect, no, so yon, disease? Okay, so there are only about what? Okay, there are only less than 1% that can cause illness to human. Imagine, there are 1 trillion. So, you get 1% of that 1 trillion. Okay, less than 1% of that can cause illness to human. In short, can I say that most microorganisms do not cause disease to human? Can I say that most microorganisms do not cause disease to human? Yes or no? Yes, I can say, class, that most microorganisms, they do not cause disease to human. Most microorganisms, they do not cause disease to humans, class. Okay, so that's what we call class your what? What do you call that? Natural immunity. Okay, natural immunity. What about class when I say class acquired? Acquired immunity are achieved once you are exposed, no, to the environment. So again, those 1%, now those are dangerous because once it enters the body, it can harm us. It can harm us. What do you call that? Acquired immunity. When I say class acquired immunity, there are two types of acquired immunity. This is very important. The two types of acquired are what we call class what? Your active acquired, and we have what we call class your passive acquired. The two types of acquired class are what we call class your active acquired and what we call class your passive acquired class na tinatawag. So when I say class active and passive acquired class, what is active and passive acquired? Active class is what? Antibodies are produced by the individual himself. Antibodies are produced by the individual himself. If antibodies are produced by the individual himself, then you call that as what we call pleasure active. Then you call that as what we call pleasure active. When I say pleasure passive, antibodies are given to the individual. If antibodies are given to the individual, then you call that as what we call pleasure passive. Then you call that as what we call your passive. Now, let's check. When I say class active versus what we call class passive, okay, question. Who is the one that produce antibodies inactive? The one that produce antibodies inactive is ako, me in English. It's ako that produce antibodies. Since it is ako that produce antibodies, that's ako ang the one produce antibodies. What is the protection if it is active class? Please answer. What is the protection if it is active? Long term or short term? Very good. Okay, it will provide what we call class what? Your long term protection. It will provide what we call class what? Your long term protection. So when I say cluster active, that's what we call your letter A, ako. The mnemonic is what? Alt. You have what we call a computer, right? Computer, if it is hanging, okay, control, alt, delete, alt. So when you see alt in the keyboard, when you see alt in the keyboard, you think of active, it is long term. Everybody, look at your keyboard there in your computer. Try to check that what? The beside the space bar. Beside the space bar, there's what we call alt. Active long term. So that's why if you are in the actual exam, you see class, there's a keyboard, active long term. I already got it. Okay, so yon. So if it is active, it will provide a long-term protection. What about class when I say class you're passive? Under what we call class or passive, antibodies are just given to you. So antibodies from another is being passed to you. Passed to you means pinasa sa iyo. Antibodies ay pinasa sa iyo. Since antibodies class are passed to you, that would only provide us what we call your short-term protection. Short-term protection. So you think of this. Psst, parang nasa kalsada ka, psst, 150. Psst, 150. Tama? So, yun. So, passive is what? Short term. Short time. Tama na? So, yun. So, question. Okay. Which is better? Which is better? Active or passive class? You tell me. Which is better class? You tell me. Which is better? Active or passive? Okay. What? Of course, active is much better. Tama? So, yon. Okay. But during emergency, you want an immediate effect. You want an immediate effect. Whom would you rely? You rely on passive. You rely on passive. Okay? Now, okay, Don't forget that. Now, under what we call cluster active, there are two types of what we call cluster active protection. What are the two types of what we call cluster active protection? We have what we call cluster natural active, and the other one is your artificial active. Under what we call class your passive, there are two types of your passive class. We have what we call your natural passive and your artificial passive. So we have what we call your natural active and artificial active. Natural passive and artificial passive class. Okay? Now, so let's try to check. Okay, so when you talk about what we call class your what? Natural active. Who produces the antibodies inactive? The one who produces the antibodies is letter A. What is A? Ako. Ako is the one who produced the antibodies. So what does it mean? Okay? The one who stimulates what we call class what? The one who stimulates antibody production. Sino class ang nag-stimulate ng antibody production? The one who stimulates antibody production is the presence of antigen. When you see antigen, our body reacts. When you see antigen, our body reacts. Our body will try to save ourselves. How would the body try to save ourselves? Emergency, emergency, immune system. We are under attack. So the immune system will now what? Okay, activate. Antibodies formation. So the the antibodies will now what? The antibodies will now be produced and attack the what? Attack class the microorganism. So there will be war. Tama? There will be war, clash of clans. Okay? Now, so during the time that your body is in war, you will have symptoms of illness. You have fever, you have vomiting, you have body malaise. Tama? Then, if you are winning the war, then you will start to recover. If you are losing the war, then you start your St. Peter's plan activation. Okay? So that's what we call as your natural active. So you achieve what we call as your natural active. How? How? Di karabaw do you achieve your natural active? You achieve natural active once you recover from a disease. Once you recover from a disease, then you achieve your natural active. So natural active, don't forget, you get this once you recover from a disease. Natural active, you get this once you recover from a disease. Do you understand? So natural active is achieved once you recover from a disease task. Okay? So question, if you have already class your chicken pox when you are 5 years old, will that provide long-term or short-term protection? If you have chicken pox when you are 5 years old, very good. That will provide what we call your long-term protection. And what is that protection? That is what we call your natural active protection. Tama? If you have what we call your measles, okay, when you were still 10-year old, what type of protection will it provide? Okay, since you recover from measles, that will provide long-term protection. And what is that type of protection that it provide? It will provide what we call as your what? Natural active protection class. Okay, so that's what we call as your natural active. What about when I say class your artificial active? When I say class your artificial active class, what you do here in artificial active is that you would inject, in artificial active, you would inject what we call class your vaccines class na tinatawag. Tama? So if you are not able to achieve natural protection, then you get protection from artificial. If you are not able to get the natural active protection, you can get it through artificial. Now question, artificial active, what is the protection? Long term or short term? Artificial active, what is the protection class? Long term or short term? That will provide what we call class your okay, long-term protection din siya class. Tama, di ba? Because it is what we call what? Active, no? It will provide long-term din because it is what we call your active class na tinatawag. Now, question. Pag ikaw ay napa-inject ng vaccine, okay, question. What is the first vaccine that you give in the US? What is the first vaccine that you give in the US? What's the answer? The correct answer is the first vaccine that you give is what we call class your. The correct answer is no one answered. The correct answer is Hepa B. Very good, Miss Shoko. Hepa B class is the first vaccine that you get. And once you talk about class vaccine, what are the content of what we call class your vaccines? Vaccine class, the content of the vaccine are that they are what we call class your germs class. Okay, so when you have yourself vaccinated, the content of the vaccine class are what we call class your microorganism. What you do is that these microorganisms are being what? They are being, okay, injected to you. So let's try to check. Which organism do you select to be injected? What color? What color of organism do you like? Okay, so because there are different types of vaccine, the color pink. You want the pink one. Okay, so yon. Okay, the circle one. Okay, so example, this is last the vaccine. Okay, so the pink is quite large. Okay, pagkasya natin siya sa loob class. Pasok, pasok, pasok. Ayan. O yung kamay mo natatamaan. Oo, oo, oo. Perfect! Okay, so yon. So when you have what we call class your vaccine, the question is, when you have yourself vaccinated, what is the content of the vaccine? Antigen or antibody? Please answer. What is the content of your vaccine? Antigen or antibody? The content class is what we call class your antigen class. No, so yon. So when you talk about what we call class your antigen, there are three types of your vaccines class na tinatawag. The three types of vaccines are what we call class your what? We have what we call class your live attenuated vaccines class. We have what we call cluster live attenuated vaccine. When you talk about cluster live attenuated, okay, it is buhay, pero it is what we call cluster weakened microorganism. It is buhay, but it is what? Weakened microorganism. When I say class weakened, malakas or mahina, mahina class. No, so yon. So, it's a weakened microorganism. Common question in the exam. If it is live attenuated, can you give class live attenuated to a person class with AIDS? Yes or no? No, because your immune system is weak. Can you give this to a child with leukemia? With leukemia? No. Can you give this to a person who is undergoing organ transplantation? Organ transplantation? No. They take immunosuppressive medication. Can you give this to pregnant mother? No. They might be teratogenic. Okay, can you give your live attenuated vaccine to healthy patient? Can you give live attenuated vaccine to healthy patient? Yes. No? So yon. So you can still give it to healthy patient. Okay, but question, if the patient class is pregnant, if the patient class is immunosuppressed, if the patient class is pregnant, if the patient class is immunosuppressed, can you still give the vaccine? Can you still give? Siyempre may kwan may drama yan. Okay. Can you still give the vaccine? Yes or no? The answer, yes, class. You can still give the vaccine. Yes. But you do not give the live because you still have other option. You can still give the I and the T. You can still give the I and the T. When I say class your letter I, what is letter I? Letter I is what we call class your what? Inactivated, or what we call class your what? Killed microorganism. You can still give the letter I, inactivated, or what we call class your killed microorganism class. No, so yon. You also have what we call class your toxoid class na tinatawag. When I say class your toxoid are best defined as what we call class your modified toxins. Your toxoid are best defined as what we call class your modified toxins class na tinatawag class. No? So when you talk about class your modified toxin, okay, ito class ay lason na ginawang hindi nakakalason. Ito class ay lason na ginawang hindi nakakalason. It's a non-poisonous toxins. Okay? Now, question. Okay, a common question again. You have what we call pleasure influenza vaccine. This is a common question. Influenza vaccine. Influenza vaccine commonly is a type of inactivated or killed vaccine. Okay? Try to listen to the question. Can I give inactivated flu vaccine to a pregnant mother? Can I give inactivated vaccine to a pregnant mother? Yes or no? Yes, very good, Aki. Very good. Yes. Can I give this to a patient last with AIDS? Can I give this to a patient last with AIDS? Yes or no? Yes, because they are already inactivated or killed. It will not harm you because it's already killed. Tama? Question. What type of protection will vaccine provide? What type of protection will vaccine provide? Long term or short term? What type of protection will vaccine provide? Long term because it's active. Remember, again, I always teach you, beside the space bar, there is out. When you say out, that's active long term. Okay? That's active long term. What about class? When I say class, your passive class na tinatawag. Under what we call class, your passive class na tinatawag, okay, pinasahan ka ng antibodies. And when you talk about what we call pleasure passive, may dalawa tayong klaseng passive. We have what we call pleasure what? Natural passive. And we have what we call pleasure what? Artificial passive class na tinatawag. So we have natural passive and we have what we call your artificial passive class. Now, when you talk about passive naturally, how can you pass? How can you pass antibodies in a natural way? You can pass antibodies in a natural way. We have what we call cluster NP. When I say cluster NP, we have what we call cluster what? Nanay to fetus. NP. Nanay to fetus last. No, so yon. So when I say cluster nanay to fetus, that's what we call cluster NP class na tinatawag class. So that happens during what we call cluster what? Your third trimester. Nanay to fetus transplacental. Nanay to fetus transplacental. Question, on what trimester would the mother transfer antibodies to the baby? On what trimester will the mother transfer antibodies to the baby? Very good. Very good, Liana. Eliza Villanueva. At the end of second trimester and throughout the whole third trimester, you transfer your antibodies. You transfer your antibodies. Okay? Now, okay? After delivery, you can still transfer antibodies. How? Via breastfeeding. You need to understand what is the first flow of milk na lumalabas class sa dede. What is the first flow of milk that comes out of the dede, the breast, the dede, colostrum? Is it rich in antibodies? Yes or no? Yes, that is rich in antibodies class. Very good. Now, so when you talk about cluster antibodies, what is the other name of antibodies? What is the other name of antibodies? The other name of antibodies is what we call class what? Immunoglobulin. The other name of antibodies is what we call class what? Immunoglobulin. When I say class immunoglobulin, there are different types of immunoglobulin that we have. What are the different types of immunoglobulin that we have? Class, the different types of immunoglobulin are IgG, IgA, IgM, IgE, and IgD. So these are the different types, no, of antibodies that we have. Now ngayon, so when you talk about natural passive na tinatawag, okay, ano class ang pinapasa natin sa natural passive? Under what we call class your natural passive class, ang pinapasa natin is what we call class your IgG. Under natural passive, ang pinapasa natin is what we call your IgG. Tama? So yon. So when I say cluster IgG, okay, that's what we call cluster what? We have what we call cluster transplacental. So don't forget ha, bakit ka naging pregnant? Naging pregnant ka kasi nakipag-G, nakipag-jer ka. You get pregnant because you get jer. Okay? Now, what about lesser breastfeeding? How can you, what antibodies are transferred via breastfeeding? Breastfeeding. What is that antibodies that's transferred? The antibodies that transferred is what we call cluster IgA. So the antibodies is that IgA. Bakit? Lahat ng gatas in the grocery store, all milk in the grocery store, they start with letter A. All of milk. So what are the milk in the grocery store that starts with letter A class? Alpine, Alaska, Angkor, Anlin, Anido, Aberbrand, Alactum, di ba? Abuna. Diba? So yun. So we have what we call class your natural passive class na tinatawag. So under what we call class your natural passive, that is what we call class your NP. So what does NP stands for? So NP stands for what we call class your nanay to pitos. Nanay to pitos. Tama? What is the protection again? Long-term or short-term? Short-term. Tama? What is that antibodies that's transferred transplacentally? Transplacentally, IgG. Antibodies that transfer to breastfeeding, IgA class. Very good. Okay. Now, for the last part, we have what we call cluster artificial passive. When I say cluster artificial passive, what you do here is that you try to inject, no? But this time, what do you inject in artificial passive? This time in artificial passive, what do you inject? You inject class or what we call class what? Your antibodies class. So what you inject are what we call class your antibodies class. No? So yon. So example, this is what we call class what? This is what we call class your antibodies. Yes. Okay. So let's try to crop the antibodies here. Yan. Yun. So you place these antibodies, okay? Did you see that? That's the antibodies class. It has a lot of weapon class, no? So yon, okay, papasok na po. Okay, so yon yung antaba mo, ha? Nakakain ka na kain, ha? So yon, yan, kasya na siya. Okay, so yon, that's artificial passive. The content is what we call, kailan kain eh? Samgyup ng samgyup. Tapos ang in-order pa sa samgyup, pati beef. Pati beef ang in-order sa samgyup. Ngayon, for artificial passive class, what do you inject is what we call cluster antibodies. What do you inject is what we call cluster antibodies. So when you talk about antibodies class, no, so yon. So that's artificial passive. So for artificial passive, when do you give this? You give this class post-exposure. You give this class when? Post-exposure. So when I say cluster post-exposure, kapag na-expose ka na. Tama? For example, ano example na na-expose ka na? Okay, so yon. For example, okay, so yon. Rabid dog biting human. Ayan. Sample. Rabid dog biting human. Okay? So example, there's what we call class, example. Ayan. Ah! Ngayon, question. Okay. Are you exposed to rabies already? Yes or no? Yes. Okay, so yon. So look at that. No, so yon. You are already exposed last to the virus. So this is what we call cluster post-exposure. So most likely, this human have what we call cluster what? This human have already class virus in the body. No, since this human have already class virus in the body. Okay, look at that. Okay, that is a human very angry. Okay, so yon. So since this human had already virus in the body, okay, what do we need here? what we need here is to inject what we call class your antibodies, right? You need to inject the antibodies so that the antibodies last would kill what we call class your what? Your viruses last. Okay. Fire in the hole. Brat-tat-tat-tat-tat-tat. Brat-tat-tat-tat-tat. Okay, so yon. So that is the concept of what we call class your post-exposure class. Now, so when you talk about post-exposure, you need to give it within 72 hours after exposure. General rule, you need to give it within 72 hours or the earlier the better. Although there are some that is allowed even 1 week, but this is just a general rule. For example, we have what we call class your Hepa B immune globulin. Okay, that's one example. We have what we call class your gamma globulin of your rubella. Okay, gamma globulin of your German measles. Okay, these are example of what we call class what? Artificial passive. Once again, what is the content of artificial passive? Antigen or antibodies? What is the content? Antigen or antibodies? Antibodies class. No, so yon. For your artificial active, what is the content for artificial active? For artificial active, the content is what we call class your antigen. So it is what we call class your vaccines class na tinatawag. So again, these are general rule for what we call class your immunity. Okay, don't forget that very important in your examination. Okay, so you just need to memorize and understand the 4 types of immunity: the natural active, artificial active, the natural passive, and the artificial passive class. Okay? So yon. So that's what we call class your what? Your immunity class. Okay, clavo class. Huh? So yon. Now let's proceed to what we call class another important topic in your exam. Another important topic, was I able to discuss medical and surgical asepsis? I think I discussed that, right? Medical and surgical asepsis during safety and infection. I think I was able to discuss that. Okay? But what I was not able to discuss is your transmission-based precaution. When I say class transmission-based precaution, transmission-based precaution are applicable for patients last who are what? They're applicable for patients last who are said to be what? Highly contagious ang sakit. If the patient have what we call as your highly contagious disease, then you apply transmission-based precaution. And when you talk about less transmission-based precaution, there are 3 types of transmission-based precaution class. What are the 3 types of transmission-based precaution? The 3 types of transmission-based precaution is in the mnemonic of what we call class your CAD. Now, question, okay, do you apply transmission-based precaution when you take care for HIV positive patient? Do you apply transmission-based precaution if you take care for HIV positive patient? No. No class. No, no, no. Because HIV is not highly contagious. Tama? Hindi naman highly contagious ang HIV. If you hug a person with HIV, if you use the what? The utensils of a patient that's with HIV, do you get HIV? No. Right? So that's not highly contagious. If the patient does not have a disease that is highly contagious, then what type of precaution should you apply? You apply what we call class what? Standard precaution. What is that precaution that you apply? Only standard precaution. Okay? Now, so this is only applicable to patients who are said to be what? Highly contagious. So class, no, in your examination, there are 3 important types, no, of what we call class your transmission-based precaution. And what are they? We have what we call class your what? CAD. So when I say class your CAD, what does CAD stands for? We have what we call class your contact precaution. We have what we call class your what? Airborne precaution. We have what we call class your what? Droplet precaution. So we have what we call class your contact precaution, your airborne precaution, and the last is what we call class your droplet precaution. Your contact precaution, your airborne precaution, and the last is what we call class your droplet precausion class. Now, when you talk about what we call class your contact precaution, what is less the mode of transmission under what we call class your contact precaution? Under what we call class your contact precaution, what's very important is know the mode of transmission of the disease. You need to know the mode of transmission of the disease last. Okay? Now, so under what we call class your what? Okay, so yon. Under what we call class your contact precaution, okay, what is last the mode of transmission of the disease? The disease is what we call class your what? The disease is what we call class your okay, the disease is what we call class your what? Okay, your fecal oral or the disease is what we call class your skin to skin. If the disease is what we call class your fecal oral, can you give me example of diseases which are fecal oral? Give me example of diseases last which are fecal oral. Diseases which are fecal oral are what we call class what? Typhoid fever. We have what we call class your Hep B. Typhoid fever, Hep B, ayan. These are what we call class your what? Contact precaution. Ay, mali ako. Sorry. What are these? Hepa A. Hepa E, not Hepa B. Hepa B is just standard precaution. Again, I repeat. The diseases which are under contact are Hepa A and Hepa E. Okay, actually, we have a mnemonic, no? Okay, so yon. So that's your cholera is also under your contact. Salmonella is also under what we call class your contact precaution class. Okay, so yon. Next, we have what we call class your what? We have what we call class skin to skin. What are diseases which are transmissible via skin to skin? Diseases that are transmissible via skin to skin, we have what we call class your scabies. Very good. Actually, call them as what we call your SIPA. Okay, SIPA. Mm. Contact sports. SIPA. What is SIPA? We have what we call class your scabies. Galis, right? We have what we call class your impetigo. Okay, impetigo is characterized by what we call your what? Honey-crusted lesion. Okay? Now, anong important key points for your impetigo? What is less the causative agent of impetigo? What is less the causative agent of impetigo? Impetigo is caused last by what we call you what? Staphylococcus aureus. It is caused by Staphylococcus aureus. There is what we call class what? Pediculosis. There is what we call what? Pediculosis. Pediculosis is kuto. Pediculosis is kuto. You also have what we call your abscess. May nana sa ilalim ng balat. Abscess. No, so yon. So wound infection are also under what we call class what? Contact precaution. Okay? So again, what are the two mode of transmission? Your fecal oral and the other one is what we call your skin to skin. Don't forget this, these are important diseases. Or you can use what we call class the mnemonic. The mnemonic is what we call class your Mrs. We. Ayan. The mnemonic is what we call class your Mrs. We. Okay, so yon. So when you talk about class your Mrs. We, yes, okay. So, okay, basta, alright. Tama, so yon. What are under what we call class your contact here? Yes! Okay, so yon. Mrs. We. Now, when you talk, oh my God. Okay, so yon, it's low bat. Pag 5%, nako, yan, it's again low bat last. No? My iPad is always low bat. Now, so we have what we call class your Mrs. We class. For Mrs. We, letter M. Can you give me example of your multi-drug resistant organism. It is not responding to the usual antibiotic that you give. Ama, it's not responding. Can you give me example? We have what we call class your what? We have what we call your MRSA. In an exam ha, MRSA. What is MRSA class? That is what we call your methicillin resistant Staphylococcus aureus. Methicillin resistant Staphylococcus aureus. MRSA. We have what we call class your VRSA. Vancomycin, vancomycin resistant Staphylococcus aureus. Okay? We also have what we call as your VRE, vancomycin, vancomycin resistant Enterococcus. Enterococcus. VRE naman. Vancomycin resistant Enterococcus. Okay, so again, you call this as what we call as your what? Multi-drug resistant organism. Place it under contact. There are some respiratory, not all ha, majority of respiratory infection are under droplet. But there are some that are under what we call contact, like what we call as your respiratory syncytial virus. So if this comes out in the exam ha, RSV is under what? Droplet or contact precaution. RSV is under what we call your what? Contact precaution. RSV is under what we call class your contact precaution class. No? Next, you have what we call your skin infection. So Staphylococcus, streptococcal skin infection, wound infection, okay, that's skin to skin. Enteric, like your C. diff. C. diff are usually causing a greenish diarrhea because of antibiotic. You have that greenish diarrhea because of antibiotic. When you answer exam about C. diff, what is very important to take note? What is the precaution, okay, under what we call class your C. diff? What is the precaution under C. diff? Contact. But one important thing that you should note in your C. diff is that alcohol is not effective. One important thing that you should know is that alcohol is not effective. But for other contact, alcohol is effective. Okay, so only hand washing. Very good. Eye infection like conjunctivitis or sore eyes, that's under contact precaution. That's under contact precaution. Do you follow? So again, we have your contact pneumonic. What is less your pneumonic? Mrs. We. So multi-drug resistant, some respiratory infection like RSV and para-influenza virus. Para-influenza virus. Okay, you also have skin infection. You also have enteric isolation. And we also have what we call class your eye infection. Okay, so don't forget, we have what we call class your Mrs. We class, not tinatawag. We have what we call class your Mrs. We class. Okay, so yon. So again, that is what we call class what? That's what we call contact. Now, okay, take note. We already know contact precaution. Okay, now what is the important intervention under contact? Knowing that the patient is under contact precaution, what type of room should you place the patient? You need to place the patient class or what? In what we call class or what? We have what we call class or, okay? Okay, we have what we call class or private room class na tinatawag. So we have what we call class or what? Okay, okay, private room class na tinatawag. So when I say class private room, how many patients do we have under private room? How many patients do we have in a private room? Isa lang. Isa lang. Wow. Tama. So yon. Isa lang class ang ating patient class. Question, can we share the room can we share the room to other patient class? Yes or no? Okay, so yon. So we have what we call class what? Okay, so yon. We have what we call class what? Okay, so yon. So we have what we call class your. Can we share the room to other patient class? Yes is the answer. You can share the room to other patient. You have the term cohorting. You have the term cohorting. Now, question in the exam. Whom can you cohort your herpes? Whom can you cohort with your herpes? Right? Now, so the answer is that there should be same causative agent or same microorganism. So question, can you cohort your herpes and your chickenpox? Can you cohort your herpes and your chickenpox? The answer actually is yes. Because why? They have same causative agent. Okay? Now, can you cohort class your bacterial pneumonia and what we call class your viral pneumonia? Okay, can you cohort what we call class your bacterial pneumonia? Okay, so yon. Sick bacterial pneumonia and viral pneumonia, yes or no? Okay, the answer class is yes. No, so you can still cohort bacterial and what we call class your viral pneumonia. We have what we call class your bacterial and what we call class your viral pneumonia class. No, so yon. So when you talk about what we call class your bacterial and viral pneumonia, no, you cannot cohort them. Why not cohort them? Because they have different causative agent. Do you understand? Can you cohort measles and German measles, by the way? Can you cohort measles and German measles, by the way? No, because they have different causative agent. Okay? So, we already understood the concept of cohorting private room. Next question. What do you do with the door? Can the door remain open or the door is always closed? What do you do with the door? Okay, will you close the door all the time or the door may remain open? Or you just bang the door? What do you do with the door? What do you do with the door? Okay, so under contact precaution, the door may remain open. The door may remain open. Now, question. Okay, when you enter the room of the patient, you need to wear PPE. When you enter the room of the patient, okay, so yon, you need to wear what we call classroom PPE. So when I say classroom PPE, that's what we call classroom what? Personal protective equipment, right? So what is that? You need to wear your gloves and your gown. You need to wear your gloves and your gown, especially gloves, right? So if there are only one option that you should choose, which should you choose? Gloves or gown? You choose gloves. Okay? You need to choose gloves last. Okay? Now, next, if the patient has what we call diarrhea, do you need to wear mask? Try to think. If the patient has what we call class diarrhea, do you need to wear mask last? Yes or no? Okay, so yon. So we have what we call class what? The answer class is no. You don't need to wear mask class na tinatawag class. No? So yon. So again, that is your contact. Now, very important, dedicated, or what we call class your personalized ang equipment. When I say class dedicated or personalized ang equipment, what do you mean by that? If you have a BP apparatus, a thermometer, a dressing, a scissor, can I use it to other patients in the hospital unit? No. You cannot use it to other patients in the hospital unit because you're spreading the organism. Okay, that is only dedicated for patient use only. Okay, so if you have a baso, kutsara, tinidor, and plato, in English, glasses, plate, spoon, and fork, that is only used by the patient only. You cannot use it to your visitor. Okay? Okay? Or you can use a disposable spoon, disposable fork, disposable cup. Just like when you go on outing. Right? Disposable. Okay? Now, so that's what we call class contact precaution. I have a question. When do you wear the PPE? When do you wear the PPE? Before you enter the room or after you enter the room? When do you wear it? Before you enter the room. When do you remove the PPE? When do you remove the PPE? Before you leave the room or after you leave the room? Before you leave the room, you remove the PPE. Before you leave the room, you remove the PPE. Okay? So again, you call that as what we call class what? Contact precaution. You call that as what we call your contact precaution. What about class when I say class your airborne precaution? Under what we call class your airborne precaution, ano naman ang tandaan under what we call class your airborne precaution? Diseases which are classified as airborne are diseases that can be transmitted more than 3 feet. Diseases that can be transmitted more than 3 feet. And what are diseases that can be transmitted more than 3 feet? We have what we call question what? MTV. So try to think of MTV as your airborne class. So oh my God, oh my God, I need to charge. Wait lang class. No, ikaw lang charger. Charger that. Follow mo yan. Ayan! Okay, so yon. So we have what we call as your a charging iPad. Okay, so yon. The iPad is now being charged. You see that? It's not low bat anymore. Wala bang iPad na 5 days pwedeng gamitin? Okay, so yun. Pag sinarge mo sa buong araw, yung pang 5 days ka na mag-charge ulit. Okay, so we have what we call as your airborne. So when I say that's diseases which are classified as what we call as your airborne, ano class ang ating airborne? So when I say class your airborne, we have what we call your letter M. What is letter M? Missiles. Okay, that's a common topic nowadays, missiles. Missiles is what? Rubiola or rubella? Measles is your rubiola. Measles is rubiola. Next is your TB or tuberculosis. Tuberculosis is airborne. What about German measles? Measles is airborne. What about German measles? German measles is German measles is German measles is German measles is droplet. No, so yon. German measles is what we call class your droplet. And letter V is what we call class your varicella. Varicella is also known as what we call class your what? Chicken pox. Varicella is also known as what we call class your chicken pox. Kasi yung chicken ay may pakpak. Chicken pakpak, chicken pakpak. So we have what we call class your MTV on air. M T B on air. No, so yon. So what's your mnemonic? M T V on air. Okay, ako lang gumagawa ng sarili kong moves. Okay, so we have what we call airborne. Don't forget. If it is airborne class, okay, is an ordinary private room enough for the patient? If it is airborne, is an ordinary private room enough for the patient? Yes or no? The answer is no. You need, very good, you need a special room. You call that as what we call as what? Your negative air pressure room. You need a special room. You call that as your negative air pressure room. Now, when I say class negative pressure room, what is special with this room? When you talk about class your negative, okay, air pressure room, that is applicable for airborne, While your positive air pressure room, are applicable for immunocompromised. Positive air pressure room are applicable for immunocompromised. So you have here example of what we call pressure negative, and the other one is what we call pressure positive air pressure. Let's start. Okay, this is an example of what we call class of a negative air pressure room. So when you enter the room, there's a first room here. What do you call this room? Okay, you call this room as what we call class of what? Anteroom. Okay? So in airborne, this is where you wear and you remove your PPE, especially mask. You do not remove the mask before you leave the room of the patient. When you remove the mask before you leave the room of the patient, then you can already inhale class the microorganism. So where do you remove the mask? Where do you remove the mask? In your what? Airborne. You remove it in the anteroom. Okay? Now, why is it called as your negative air pressure room? Why? Why? Why is it called as a negative air pressure room? This is a special room. This special room class has two ventilator. In Tagalog, dalawang ventilador. This room is special because it has two ventilator. In Tagalog, anak, ilabas mo muna yung dalawang ventilador. May bisita tayo. Tama na sa'yo. So when you say class your two ventilator, isang ventilator, what does it do? It pumps in sterilized air. It pumps in sterilized air. Tama na sa'yo. And the other ventilator, it sucks out dirty air. It sucks out dirty air. So the air is being cleaned inside. Tama? The air is being cleaned inside the room. Do you understand? Okay, so ang linis ng hangin kasi palagi siyang nililinisan, class. Tama? So yon. Now, what is the setting for the negative air pressure room? The setting for the negative is what we call class what? 6 to 12 air exchanges per hour. We have what we call cluster 6 to 12 air exchanges per hour. So when I say class 6 to 12 air exchanges per hour, ano class ang ibig sabihin? 6 to 12 air exchanges per hour class. No? So yon. So that's what we call class your airborne class na tinatawag class. No? So yon. That's what we call class your airborne. Okay? But if the patient is immunosuppressed, what is the role of the patient? Patient that is leukemia, patient of a very low absolute neutrophil count. What is that? Yes, positive air pressure room. Okay? Now, the main difference is the direction of the air. Why? If it is positive air pressure room, the what? The air is going outside. Okay, so the air is going outside so that the patient will be protected. So that the patient will be protected. If it is negative pressure room, the air is going inside. Okay, that is to prevent spread of organism. That is to prevent the spread so that the organism is remained there inside. Okay, so just imagine this we have a microorganism here. Let's check for the microorganism here. I think it is here. Let's borrow the microorganism here. Then you have here what we call negative air pressure room. In negative air pressure room, what happens last in negative air pressure room? Okay, the air class is going what? Inside or outside? The air is going inside. So if the air is going inside and the organism is there, can the organism go out? Yes or no? So the air is going inside, the organism wants to go out, but the air is pushing it in. I wanna live, I wanna live. No, no, no. I wanna live, I wanna live. No, no, no. Okay, so yeah. So that is your what? Airborne negative air pressure room to prevent the air from going outside. Okay, so that is to prevent the spread of microorganism. Do you understand? Okay, so that's what we call class your airborne precaution. Okay, now let's proceed. If the patient has what we call class your airborne disease, the question now is we will put the patient class on a special what? O airborne disease class na tinatawag. Under what we call class your airborne disease class, we will now put the patient on what we call class your what? Okay, negative pressure room. And once we enter the room, the patient should wear what we call your N95 or respirator mask. The patient should wear what we call as your N95 or what we call as your respirator mask. Okay, so that is what we call as your airborne class na tinatawag. Okay, that's what we call as your airborne class na tinatawag. Okay, now, what about last droplet? For droplet, the transmission is within 3 feet. So when I say class droplet, okay, it is a respiratory disease but not included in your MTB. It is a respiratory disease but it is not included in MTB. So what should you understand about what we call pressure droplet? What should you understand about what we call pressure droplet is that we have what we call pressure one. Okay? So we have here your mnemonic here for droplet. Very important in the exam, ha? For droplet. Okay, for droplet, the transmission can only happen for droplet if it is within 3 feet. What do you mean by that? If I enter the room or if I open the door and the patient has pneumonia inside the room, can you get pneumonia if you just open the door and smell the air? Actually, no. You cannot get it. You only get your droplet infection if there is close contact. Okay, when you talk to the person personally, tama, no? So yon, when you are going to what? When you're going to talk to the person personally, when you're going to sing together with that person face to face, duet kayo, tama? So yon, that's how you get, no? So yon, okay, your droplet. For droplet, think of this, Spider-Man. For droplet, think of this, Spider-Man. So when I say Spider-Man, letter S. What is letter S in Spider-Man? We have scarlet fever. This is a common question now in the exam. Who can tell me what is the mode of transmission of scarlet fever? Who can tell me what's the mode of transmission of scarlet fever? This is a common trend now in the exam. Scarlet fever. What is the mode of transmission? The answer is, the answer is droplet. The answer is what we call class droplet. For scarlet fever, what is the tongue in a patient class with scarlet fever? Ano class ang tongue ng patient class na may scarlet fever? The patient have what we call class your strawberry tongue class na tinatawag. The patient have what we call class your strawberry tongue class na tinatawag. Do you follow? Okay, there's what we call class what? Is streptococcal pharyngitis. When I say class streptococcal pharyngitis, that is what we call class your sore throat. That is what we call class your sore throat, streptococcal pharyngitis. Is sore throat contagious? Sore throat, sino sore throat ako ngayon, class? Sino sore throat ako? Okay, yes, it is. Tama? Okay, it is droplet. Okay? Next, we have what we call class what? Okay, we have what we call class your fifth disease or parvovirus. Your fifth disease, parvovirus, is different from the DOGA. This is parvovirus B19. Okay, so fifth disease would produce what characteristic symptoms? What is that characteristic symptoms that you see in patient class with fifth disease? The child would have the characteristic slap cheek appearance that is symmetrical. Pa! 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 Okay, so yon. So you try that also. You try that also so that you can see, okay, you have five fingers, no? You slap your face. Pa! 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 Slap cheek appearance. Can you open your camera and you try that yourself? So we call that as your fifth disease. So that is a different virus from the dog, okay? That is parvovirus B19. Pneumonia is droplet. Pertussis, okay? Pertussis is also known as whoop. Merry Christmas. Okay, so pertussis last, no? Where is your cancer? Cannot you, hindi nyo ko nakikita, class. You need to pin me. Can you see me? I am here in the resort. Can't you see? I am here in the resort. Cannot you see? Okay, I'm here in the resort. You need to pin. You press the right light, click there. Because wala siya spotlight yan eh. You press the pin button. Okay, do you wanna see me? I am here, oh. Okay, so where am I? Yeah, then you press here, then you press the pin. Okay, you press this, okay? Ayan. You press that, then after you press this one, okay? So that you can see me. Okay, so that you can see me this afternoon and you can see me tonight, okay, in your dream. Okay, so yon. Okay, you will think of Spider-Man. Okay, so yan. Okay, so yeah, that's me. I'm here at the infinity pool. Okay, so yun. So we have here what we call class your pertussis, not pertussis. Next, we have what we call class your influenza. Influenza is flu, tangkaso. Okay, so yon. Next, diphtheria. Okay, diphtheria is hindi naman lumalabas sa exam. Hindi lumalabas sa exam. Baka lumabas sa exam nyo, you need to tell me, okay? So diphtheria produces a pseudomembrane in your throat. That produces a pseudomembrane in the throat. Why is diphtheria not common nowadays? Why is diphtheria not common nowadays? Because why? There's already a vaccine. Very good, Aki. By the way, I have a question. Can you cohort scarlet fever and sore throat? Can you cohort scarlet fever and sore throat? Yes or no? The answer is yes. You need to change your answer. The answer is yes. You can cohort your sore throat and kwan. You can cohort. Why can you cohort them? Because last, no, pareho silang GABs. Streptococci. The same causative agent. Pareho silang GABs class. Do you understand? Okay, so yon. Next, we have what we call your epiglottitis. Epiglottitis is also droplet, and in the exam, no, is epiglottitis emergency. Is this emergency? Yes. You tell me, what is the pathognomonic sign of epiglottitis? Because that can affect the airway. There's a stridor. There's stridor class. What happens? Okay, not stridor. I'm not looking for stridor. I am looking for what we call class what? Your tripod position. The child class would have what we call class your tripod position in what we call class your epiglottitis. This is characteristic. Okay, so that is what we call your tripod position. Okay, okay, so yon. So in your what we call your epiglottitis class, tama, so yon. Then after that, you go to the mall, you position yourself in that position, then you jump, okay, so that they would think that you are a frog. Okay, so yon. So you have your croupy cap. You have your croupy cap. No? So yon. So that's what we call your epiglottitis. Okay? Next, your Rubella. Rubella is what we call class what? Measles or German measles. Rubella is what? Measles or German measles. Rubella is what we call class your German measles. Because rubiola is measles. Okay? German measles. Rhinovirus. Rhino, these are respiratory yan. Mumps or parotitis beke, bacterial meningitis, adenovirus is also common in some of my students. Ha? Now, if the question is RSV, if the question is RSV, what type of precaution should you place? RSV. RSV is placed on, what's the answer? The answer is contact precaution. Contact precaution. If the question is adenovirus and the symptoms are respiratory, you place it under droplet. But adenovirus having symptoms of diarrhea, adenovirus symptoms having diarrhea, then you place it under contact precaution. Do you follow, class? Okay, so yon. So that's what we call class your what? That's what we call class your contact precaution, airborne precaution, and what we call class your droplet precaution. When you think of droplet precaution, you think of whom? You think of Spider-Man. Okay? You think of Spider-Man. Now, question. If a patient is placed under droplet precaution, if the patient is placed under droplet precaution, what do you do with the door? The door. Of course, you see the door in the examination. When you take the exam, you see the door. This is the door. What do you do with the door? Do you do you keep the door closed or the door may remain open? Do you keep the door closed or the door may remain open? You place the patient in a private room. What do you do the door? The correct answer is the door may remain open. The door may remain open. The door that is always closed is what we call class what? Airborne. The door that is always closed is what we call what? Airborne. Okay? Do you follow? Okay? So dito, you have what we call your private room. Private room. Okay? Is it required to have a negative pressure room? No need. An ordinary private room. And once you enter the room, you wear mask. What type of mask? N95 or surgical mask? Surgical mask is okay. Surgical mask is okay. Do you follow? Then you just apply the rule of what we call cluster standard precaution. So you can still apply the rule of what we call class standard precaution. If you understood that, what are the important key points that I have discussed? Okay. So you need to chat your answer. Okay. Chat your answer, class. Okay. Now, question. Okay. This is my question. The patient should be placed on a negative air pressure room. The patient should be placed in a negative air pressure room. What is that? That is airborne. Very good, Aki. Okay, Aki is the fastest keyboard warrior. Okay, so you get Gcash from, okay, Ma'am Ansel. Congratulations. Ngayon, okay, so we have what we call class yard. Okay, you have what we call class yard. What about class if the door is always closed? The door is always closed. The door is always closed. What is that? That is what we call airborne. Very good. Very good. The fastest is Liana. Okay. Liana, congratulations again. Now, question. Okay. This is where you are going to remove your N95 in airborne. This is where you're going to remove your N95 very good. Tama? Next question. Okay, you don't need to wear a mask. You don't need to wear a mask. What is that? You don't need to wear a mask. What's that? Contact. Very good. RSV. RSV, contact, airborne droplet. Okay, contact, measles. Ay, airborne ako nakamali. Okay, nakamali class. Ha? So yon, RSV, kitang-kita, mali ha? Mali ha? So yon. Okay, next question. We have what we call class your, okay, measles. Measles is what? Measles is, oh, mabilis talaga si Aki. You get another Gcash. Okay, from Ma'am Ansel. Now, next, we have what we call class your, okay. Okay, okay, yun na yun. Wala na akong sabihin. Now, question. Can you transport the patient, class? Can you transport the patient if the patient is placed under contact, airborne, or droplet? Can you transport the patient? As much as possible, we need to limit transport. Okay, so that, okay, we need to limit transport so that we can what? Bakit kailangan limit? To prevent the spread of microorganism. So under what we call cluster contact precaution, if you are going to transport the patient, you need to cover the affected area. You need to cover. Kung ano yung affected area, just cover it. Then the patient is allowed to transport. Okay? If it is what we call cluster airborne, airborne ha, as well as droplet, you need to what? Ask the patient to wear what we call cluster what? Ano dapat susutin ng patient kapag ito ay droplet? The patient class should wear what we call cluster what? N95 or surgical mask lang. The patient should wear what we call class your surgical mask lang. Who should wear the surgical mask? The patient or the nurse? Who should wear? The one that should wear, class, is the patient. Okay? The nurse does not need to wear. Okay? You just limit transport. And once you reach a certain area, that's the time that you apply the rule of your transmission-based precaution again. Okay? So those are important key points ha, for what we call, class, your contact, airborne, and droplet last. Okay? So siya. Let's have our break, class, muna, class. Okay lang? Let's have our break. After the break, we'll proceed, class, with our discussion. Okay, break muna tayo. After the break, we'll be discussing diseases na. Okay, leave lang muna ako dito, ha? Ingat kayo, class. See you after 20 minutes, ha? 20 minutes. Sorry, class. Ayan. Grabe, ang daming nakapasa ngayong araw na ito. Okay, so yun. Kaya nag-congratulate. Di ko nga makatanong-tanong yung mga lumalabas sa kanila. Pero talagang ngayong buwan, talagang yung trend talagang ngayon buwan, ang daming cardio. As in ECG class ang lumalabas sa kanila, class. Kaya, pero pasado sila po sila mga 85 stop po. Kapag nagtatanong ko kung anong lumabas, tama, so yun, mahirap daw yung exam, tapos ito, procainamide, digoxin, oh, madami siyang prioritization, ayan. O, ito yung mga questions niya. Oh. Okay, so go memorize nitong questions niya. Okay. Okay, so siya. Mag-start na po tayo ng ating discussion ulit last, no? So yon. Okay, so we have now here our nasaan naman estudyante natin? Hindi na sila nagsisibalikan. Nasaan na sila? Umuwi na sila. Okay, so yon. O, kayo naman sunod ha. Actually, madami ngayon, communicable disease, tsaka cardio. Yun talaga yung madami ngayon. Unlike kasi nung last month, ang trend ay ortho, madami, ortho. Tsaka, ano yung trend last time? Ortho talaga yung madami. Tsaka surgery. Ortho, tsaka surgery. Ngayon, ang dami communicable disease. Villanueva, yung pumasa nga Villanueva din yun eh. Kano-ano mo yun siya? Miss si Ana Jesusa Villanueva. Kano-ano mo, kakapasalan din niya ngayong araw. Ngayong hapon lang din. Kano-ano mo yun siya, ma'am? Ana Jesusa. Di ko po kano-ano. Di mo ba alam, sir? Madaming apelidong Villanueva. Yung apelido kasi masyadong common. Yung apelido. Okay, so yun. Sir, taga LPU po ako. Ay, LPU. Ay, okay. Si Randolph, oy. Kano-ano mo si Randolph, oy? Oh, pumasa yun si Randolph, oy. 85 stop yung si Randolph, oy. No? So yung nagpanik-panik yun si Randolph, oy. Classmate mo yon. Okay, so yun. Okay, nagpalitson si Randolph. Pumunta ka ba doon? Nakita ko sa kanya story, 2 lechon. Okay, so 2 lechon na in-order niya. Pumunta ka? Nakakain ka na lechon? Okay, so yon. Sana all, ha? So yon, may palitsyon. Okay? Ngayon, sir, punta ka ulit dito, Batangas. Ay, hindi, Pampanga yung schedule ko sunod eh. Okay, so yun. O siya, dito na nga tayo, class. Sana nga tayo, nalito-lito na tuloy ako. Nalato-lato na yung utak ko, ha? So, importante, class, dyan. Mag-analyze kayo. At saka pumasok kayo sa final coaching. Ang isa sa pinakamahalagang aspect ng milestones inyo, papumasa talaga kayo. Hindi ko naman sinasabi kapag compare ka, hindi ka papasa. Final coaching. Okay, pumasok kayo. Pag may ATT na kayo, magtanong kayo sa akin sa kailan ka papasok ng final coaching. Kasi yung final coaching ay every other month at isang beses mo lang pwede atinan. Now, ang question, may bayad ba yan, sir? Wala yung bayad. Bayad mo na yan eh. Gusto mo magdubli-dubli bayad? Bayad mo na yung final coaching. Kailangan mo lang sagutan yung mga exam doon. Tama? So kapag hawak mo na ATT mo, tanong ka. Okay, so yon. Kung kailan ang best time. Actually, class, pwede ka din magtanong sa akin kung kailan ang best date ka kukuha ng exam. Kasi may best date na tinatawag. Kasi titinan ko yung tracking card mo. Doon sa tracking card, meron kang best date na pwedeng kumuha ng exam. Okay? Lalo kapag medyo mababa yung scores mo. Okay, sa final coaching, pwede ka mahila ng iba mong classmate kapag pinauna mo sila ma-exam. Unahin mo sila ma-exam para makuha mo yung mga feedback. So, kailangan pumasok kayo sa final coaching pag may ATT kayo. Hindi susulo ka lang dyan, kung kumuha ka na pala ng exam, hindi namin alam, kumuha ka na pala ng exam. Bigla masisend ka na lang na, sir, pasado na ako. Ay, nag-exam ka ba? Tama, no? So, hindi namin alam. So, kailangan, pag may ATT ka, magsabi ka sa amin para malaman namin, you need to enter. Di ba iba? Iba, ganun eh. Yung biglang result na lang yung malalaman nila. Okay, ano? Okay, so yon. Si Emily ba, Kwan? Okay, message po kami. Basta pag may ATT kayo, message kayo. Tingnan ko yung tracking card nyo para ma-maximize natin class, no? Sir, pasado na ako. Oh, pasado ka na, Miss Kobe? Pasado ka na ba? Mr. Ramuel, pasado na ba yun? Joke practice lang. Hayop. Kasi mas start na nga tayo. Natulungan na lang tayo dito, class. No? So, yon. So, we have here what we call class your what. Okay. So, siya, tinan natin yung inyong mga notes, class. Okay? So, siya, we have here the next. We will start off with your diseases na class. Okay? So, for your diseases, what is the first disease that we will be discussing? Hindi pa pala ako nakapasok, class. Okay, so siya. We have here what we call class your meningitis na tinatawag. So when you talk about what we call class your meningitis, okay, this is one of the most common topic that comes out now in communicable disease. Okay, so usually you encounter one or two questions about meningitis. So what is the causative agent of meningitis? Meningitis can be caused class by a bacteria or it can be caused class by a virus. So it can be caused by a bacteria or it can be caused class by a virus. If it is a bacteria, the name of the bacteria is what we call class what? Neisseria meningitidis. It can also be caused by Hib. But Hib is not common nowadays because you already have the vaccine. You already have the vaccine. For infants last who are not yet toilet trained, you have what we call the E. coli. Because E. coli class is in the feces, right? E. coli is in the feces. Bacterial meningitis is contagious. Once again, what is the mode of transmission of your meningitis? Droplet, because that's part of your Spider-Man. Mumps and meningitis, that's part of your Spider-Man. Droplet. What type of mask should you wear if it is droplet? N95 or surgical mask? What type of mask? Surgical mask class. No, so yon. For viral meningitis, we have what we call class what? For viral meningitis, we have what we call class your paramyxovirus. We have what we call class your Coxsackie virus. We have what we call class your West Nile virus. So paramyxovirus, Coxsackie virus, and we have what we call class your West Nile virus. So they are what we call viral. Now, majority of contagious meningitis are bacterial. While viral meningitis, some of them are non-contagious, like what we call class your West Nile virus. So West Nile virus can cause meningitis, but it is not contagious human to human. So you need to check also. But generally speaking, if they just mention meningitis, you think that it is contagious. Okay, the mode of transmission is droplet. Now, what are the signs and symptoms of patients having meningitis? For patients that's having meningitis, the signs and symptoms are anything that increases ICP. Now, in the examination, okay, so yun, in the examination, if it is an infant, do you still have that soft portion here in your head here? Do you still have the soft portion? Yes. We call that as your what? You call that as your fontanelle, right? You call that as your fontanelle. What happens to your fontanelle if there is what we call meningitis? Okay, question. If the child is crying, and there's bulging fontanelle, is that meningitis? If the child is crying and there's bulging fontanelle, is that meningitis? No, that is expected. That is expected, right? If the child is feeding and there's bulging fontanelle, if the child is feeding and there's bulging fontanelle, is that meningitis? No, that is expected. So what we call signs of increased ICP is bulging non-pulsatile fontanelle. There's what we call as a bulging non-pulsatile fontanelle at rest. Okay, so yon. So these are signs of what we call as what? Meningitis. Okay, so increased ICP, poor feeding, okay, poor sucking, there's high-pitched cry. Okay, so these are signs of increased ICP. And also in the examination, you see two common signs of meningeal irritation. What are the two common signs of meningeal irritation? You have class your Brudzinski sign and you have class your Kernig sign. When I say class Brudzinski and Kernig sign, what is the difference between Brudzinski and Kernig sign? When I say class Brudzinski versus Kernig, the difference is how you conduct the assessment. For Brudzinski sign, we have what we call letter B. What is letter B? The batok. Letter B, what's letter B? The batok. Now, what do you do in your Brudzinski sign? When you try to assess for what we call as your Brudzinski sign, when you try to assess for what we call as your Brudzinski sign, if you try to flex the batok, there's what we call as your flexion of the legs. If you try to flex plus the batok, there's what we call as your flexion of the legs. You call that as what we call as your Brudzinski sign. Okay? Now, question. In Brudzinski sign, is there pain? No, we're not talking about pain here. We're looking at the response that there is flexion of the hips and knees if I try to do a flexion of the neck. So that is Brudzinski sign. But when you talk about last your Kernig sign, when you think of Kernig sign, letter K, we have what we call last your knees. Letter K, we have what we call last your knees. Why? Okay, under what we call last your Kernig sign, you try to extend the knee. Under what we call pressure Kernig sign, what you do is that you try to extend the knee. Now, you try to extend the knee, and there's what we call pain in the hamstring muscle. If you try to kick, no, or extend, there's what we call as pain in the hamstring muscle. Then you call that as what we call as what? Kernig sign. You call that as what we call what? Kernig sign. Do you follow? So we have what we call Klesher Brudzinski, and we have what we call Klesher Kernig sign. Okay? So now, we have what we call Klesher what? Diagnostic test. For diagnostic test, we have what we call Klesher lumbar puncture. Now, in your examination, okay, what is the position for lumbar puncture? In your examination, what's the position for lumbar puncture? You position the patient on what? Okay, side lying knee chest position. Diba? Side lying shrimp or side lying knee chest position. Okay, in your examination, if you're going to what? You're going to perform lumbar puncture, where do you insert the needle? Okay, saan ang insertion site? The insertion site is L3, L4, or L4, L5. L3, L4, or L4, L5. You just think of what? Car or van. I'm going to write an L3. Yes, L3, L4, L4, L5, right? Okay, so when you think of meningitis, you are on the L300, L3, L4, L4, L5. Okay? Now, so when you talk about lumbar puncture, after the procedure, do you expect headache from the patient or is it complication? Headache. After lumbar puncture, headache is expected. Okay, you just ask the patient to have a rest, don't move a lot, and drink fluids. No, ask the patient to have a rest, drink a lot of fluid. Okay, but if there is headache for after 5 days, there's still headache after 5 days, you need to notify the physician. Okay, now, what do you aspirate in your lumbar puncture? You aspirate the CSF. When you try to insert the needle here, question, what is the sepsis technique that you follow? What is the septic technique that you follow? Clean or sterile technique? You follow what we call as your clean or sterile technique. You follow what we call as your sterile technique class na tinatawag. So when you talk about what we call as your lumbar puncture, we have here what we call as your bacterial. We have here what we call as your viral. So for bacterial here, color. What is class the color if it is bacterial? If it is bacterial, the color of the CSF is what? Cloudy. No, the color of the CSF is what? Cloudy. Now, because it's a sign of infection, right? That's why it's cloudy. If it is viral meningitis, what is that? It's clear. So which is difficult to diagnose? Bacterial or viral? Viral. Tama? Now, For bacterial meningitis, it's quite obvious that the WBC would increase. For viral meningitis, it's slight increase or normal. There's slight increase or normal. Okay, so it's difficult to diagnose viral meningitis. Protein. Now, if there is antigens, right? Now, what would the body do? The body will produce antibodies, right? So what do? Expect an increase in protein, right? Yes. So there will be increase in your protein class. Now, antibodies goes to the side. For viral increase of protein, antibodies goes to the side. What about plus the glucose? The bacteria will eat the glucose. The bacteria will eat the glucose. So what happens to the glucose class? Does it go up or go down? What happens to the glucose? The glucose go down because the bacteria will eat the glucose. While for viral meningitis, it's still normal because why? The bacteria, the virus does not need the what we call class the glucose class. What is the management for patient with meningitis? Your priority is the safety of the public. Your priority is safety of the public. So that's why you need to put the patient on what? Isolation. So what type of isolation should you put the patient? You put the patient under droplet because that is part of what? Spider-Man. Diba? What is M in Spider-Man? Mumps and meningitis. Next, after the safety of the what? The safety of the other people are already established. Okay, again ha, if it is droplet, the door may remain open or the door is always closed. The door may remain open or the door is always closed. The door, the door may remain open, class. No, the door may remain open. Put the patient on what we call class 1, non-stimulating environment. Put the patient on what we call class 1, non-stimulating environment. So when I say class non-stimulating environment, what is that? Quiet or noisy environment. Non-stimulating is what we call class what? Your quiet environment. Quiet environment. Okay? So dim environment. Okay, number 3, monitor for complications. If there is already a symptom of complication, should you report it to the healthcare provider? In your exam, if you see symptoms of complication, do you report it to the healthcare provider? Yes. Complications are things that you need to report to the healthcare provider. Question, if a patient with meningitis has fever, if the patient with meningitis has high fever, do you notify the physician? If the patient with meningitis has fever, do you notify the physician? No. You don't call the doctor because that is meningitis, you expect fever. But if the patient has meningitis and there's an obvious change in the urine output, do you notify the physician? Yes or no? Yes, because a change in the urine output may signify SIAD or DI. It means that the pituitary gland are compressed. It means that the pituitary glands are compressed. Next, sequelae. Sequelae class happens a few months after. No, a few months after the infection period. A few months after the infection period, you need to check for the vision testing. So you check for the vision or the hearing test class. Okay? Why? Because, okay, it can cause inflammation of the cranial nerve causing strabismus or vision loss. Okay? Also auditory loss class. No? So yun. So that's why a few months, like 3 months after, you need to check for vision and hearing test. Okay? So that's what we call class 1, meningitis. Okay? Now, so those are the common questions in your examination. Now, let's go to what we call class your exanthemus and enanthemus disease. Okay? The term class is what we call exanthemus and enanthemus disease. Now, when you talk about what we call class your exanthem versus what we call class your enanthem, now what is the difference between the two? What is the difference between the word exanthem and the word enanthem? Exanthem means there is what we call class what? Eruption in your skin. If there is an eruption in your skin, we call that as your exanthem. Okay? So what is the other term for exanthem? The other term for exanthem is known as your rashes. The other term is rashes. What about last your enanthem? Enanthem refers last to your eruption in your mucous membrane. So when I say class eruption in your mucous membrane, okay, it can be where? In the cheeks, buccal mucosa, mucous membrane. It can be where? In the soft palate. Okay, you have those what? You have those eruptions or lesions that you can say. You call that as your enanthem. So if it is enanthem, think of this letter M. It is what? Okay, M, mucous membrane. Mucous membrane. For exanthem, it is on the skin. Okay, it is on the skin class. Okay, what is your mnemonic? No mnemonic. Okay, so you just need to memorize that. Okay, not all the time you have the mnemonic. Okay, so yeah. Now, so what are the three common diseases that you need to master? Especially the first one. The first one is the very common exam. Second is also common. But the most common now is measles. Now, measles, German measles, and we have what we call as your chicken pox. Measles, German measles, and we have here what we call as your chicken pox last. No, so yon. When you talk about what we call as your, okay, chicken and measles last. Measles is also known as what we call as your rubiola. Measles is also known as rubiola. German measles is also known as rubella. German measles is also known as rubella. Chickenpox is also known as varicella. Chickenpox is also known as varicella. Okay? Now, so when you talk about what we call measles, measles is how many words? Measles is one word. Measles is one word. That's why when you think of your measles last, since it is one word last, no? Okay, question. How many letter L is rubiola? One L. One word, one L. Okay? Now, common to when your child goes camping, tapos may isa dyan na walang bakuna, tama? So sila yung nagkakahawaan ng measles. And usually, they would ask in the exam, compare nila. Ipapa-compare ang symptoms ng measles, chickenpox, at German measles. Tama? Okay? German measles is two words. German measles is also known as rubella because rubella is 2L. Two words, 2L. So wag ka nang malito. Again, measles is one word, rubiola is 1L. German measles is two words, rubella is 2L. Okay? While chickenpox is your varicella. So question, among the three diseases, which is related to shingles? Among the three diseases, which is related to shingles? Chickenpox. Because chickenpox is the same causative agent with your shingles. Okay? Now, question, which among the following diseases you can cohort? Which among the following diseases you can cohort? None of these. Why? Because each of these have their own different causative agent. Okay? But did you know that you can cohort measles with mumps? You can cohort measles with mumps because mumps is also caused by paramyxovirus. So if you're asked, to whom would you cohort a child with measles? At a what? A child with measles. To a patient with German measles, to a patient with mumps. To whom do you cohort last your measles? To a patient with mumps. Very good, Miss O'Malley, because that has the same causative agent. German measles. German measles is caused last by what we call as your Toga virus. German measles last is caused last by what we call your Toga virus. While your chickenpox is caused by what we call as your what? Varicella zoster virus. Your chickenpox is caused by varicella zoster virus. What is the mode of transmission? The mode of transmission of measles is via airborne droplet. The mode of transmission is via airborne droplet. For German measles, the mode of transmission is via droplet. The mode of transmission is via droplet. For chickenpox, the mode of transmission is airborne droplet plus contact. Plus contact. Okay, so question. Are the rashes of the measles contagious? Are the rashes of the measles contagious? Yes or no? No. Because, no. Because, class, please delete your answer. It's wrong. Class, it is airborne droplet. Okay? Now, it's not skin to skin. Pass. Please delete your answer. Okay, I will repeat my question. Now, I repeat. Is the rashes of the measles contagious? Yes or no? No. Very good. Is the rashes of the German measles contagious? Yes or no? Is the rashes of the German measles contagious? Yes or no? No. Is the rashes of the chicken pox contagious? Is the rashes of the chicken pox contagious? Yes. Very good. Now, these three are already what we call class what? Have their vaccine. Tama, no? So, yon. So, that's why they're already less common because there is already a vaccine for that. Now, I have a question. This is my question. Since you have already class the vaccine, no? The question is, if you have rashes after your measles vaccine, if you have rashes after measles vaccine, is that rashes contagious? Yes or no? Because one of the side effects is that it causes rashes. The answer is no, because rashes are not contagious. But if the question is you had varicella vaccine and you developed rashes, a few rashes, is that contagious? Are the rashes contagious in chickenpox? Yes or no? Yes. So what do you do with the rashes in order to prevent the spread for those persons who were not able to have chickenpox yet? Okay, in order to protect other susceptible individual, what do you do? Do you isolate or cover the lesion? What do you do? Isolate or cover the lesion? The correct answer is cover the lesion only. Okay, the virus load here is very small that you don't need to isolate. You just need to cover the lesion. Okay? Kasi imagine, di ba? Nagpa-vaccine ako para hindi ako ma-isolate. Tapos, ngayon, in-isolate niyo ako dahil nagka-rasya ko. Alam mo naman, kaya nga ako nagpa-vaccine, para hindi ko, di ba? So yun, kaya nga sila pa-vaccine nga, para hindi nila pagdadaanan yung sakit. You just cover it, okay? That is not that high. It's contagious, but hindi siya ganun ka-highly contagious as what the actual disease is, okay? So you just need to understand that, okay? Now, let's try to differentiate class the characteristic. For measles, measles is quite serious and life-threatening, ha? Measles is quite serious. So measles can kill an infant. Why? The virus weakens your immune system. The virus weakens your immune system. So once now, once the muntik na malunod class na doon sa aking pool. Ngayon, once the virus weakens the immune system, the bacteria would now enter, causing what we call class complication. So it can cause what we call class your what? Pneumonia, because it will weaken your immune system. Otitis media, encephalitis, no? But the most common is pneumonia, right? And pneumonia, is it fatal among infants? Yes, di ba? Pneumonia is deadly among infants last, right? So in short, so it's a serious infection, especially for infant, child. Now, what about last your rubella or German measles? Rubella or German measles is only a mild infection class. It's only a mild infection. So why are we afraid of your German measles? Actually, class, the other name of German measles is known as your 3-day rash class. It's so mild class that the acute infection is very short. Okay, now we are cautious with German measles because it is highly teratogenic. When I say class teratogenic, it can what? It can cause cancer or it can harm the baby. It can harm the baby. Teratogenic class, right? It can harm the baby. So question, can you give your rubella vaccine to pregnant mother? Can you give rubella vaccine to pregnant mother? No. Tama, di ba? That's teratogenic. Can you give chickenpox vaccine to your pregnant mother? Can you give chickenpox vaccine to your pregnant mother? No, because that's teratogenic. Very good. So both yan, actually all of them are popular to cause harm sa baby. Okay, so again your German measles is very mild. Actually class, no? If you have your German measles, yung sakit mo parang wala lang class. No? So yon, parang wala lang. Okay? Saglit lang class, I just need to answer the call. Wait 1 minute lang. So yan. So we have what we call class your what? We have what we call class your, okay, your, anong tawag dito? Your measles is serious because it weakens the immune system. Now let's talk about class your what? Your signs and symptoms. All of these three diseases, produces what we call class the same prodromal symptoms. All of these produces the same prodromal symptoms class. But what is important is that we need to differentiate the three. Now, how do we differentiate the three class? Okay, so let's start. Okay, all of them cause symptoms of infection. You have what we call pressure fever. For measles, you have what type of fever for measles? For measles, you have what we call pressure high fever. For measles, you have what we call pressure high fever. That the more na madami ang rashes, the more na mataas ang lagnat. The more na madami ang rashes, the more na mataas ang lagnat. Okay? You also have what we call class what? The rashes are said to be cephalocaudal in pattern. So when you say class your measles, ano class ang tandaan sa measles? So sa measles, you think of letter M. Anong ibig sabihin class ng letter M? Mukha. For measles, you think class of letter M. Ano class ang letter M class? Mukha class. No? So yon. So the rashes would start from the face and going down. Okay, so that is an important keyword in the exam. Where would the rash start? If the rash would start in the face, what's that? Measles. If the rash would start in the body, what's that? Chickenpox. So don't get confused already because measles is letter M. Letter M, anong letter M? Mukha. Alangan naman matawan. 'Di ba? M, mukha. Alangan naman matawan. Matawan. Matawan, no, matawan. Ano yung sa matawan? Yung sa matawan, chicken. Because when you eat chicken, you eat the breast of the chicken, you eat the thigh, tama, right? So chicken, makdo, right? Now, so there's also what we call as what? Maculopapular rashes. For measles, the rashes are reddish in color. For German measles, German, pinkish. For German, that's pinkish. For measles, letter M, mapula-pula. Measles, letter M, mapula-pula. There is what we call pleasure-coplic spots. So when I say pleasure-coplic spots, the rashes is in the buccal mucosa. The rashes is in the buccal mucosa. So that's what we call pleasure-coplic spots class na tinatawag class. No, that's what we call pleasure-coplic spots. Now, you also have what we call, by the way, that's pathognomonic. You can see that in the exam. Okay, so yon. So these are Coplix spots. You cannot see that in German measles as well as your chicken pox. So these are procural spots that you see in the buccal mucosa. You call that as your Coplix spots. Okay, so yon. As you would notice, can you see the Coplix spots? Class, can you see the Coplix spots? These are the Coplix spots here, class. This is a Coplix spot. Can you see that? Okay, this is Coplix spots. These are procural spots that you see inside. These are, no, not this one. Okay, not this one. This one is pasta and root canal. Pasta and root canal, not this one. Okay, so, but this one. That one. So you see that in the buccal mucosa. You call that as your Coplix spots class. Do you understand class? Okay? Now, you also have what we call Stimson's line. Stimson's line are also seen in your measles. So what is Stimson's line? So Stimson's line, okay, you have what we call cluster, Stimson's line. So for Stimson's line, yan, there's what? Inflammation of the conjunctiva. Inflammation of the conjunctiva is what we call cluster, Stimson's line. Inflammation of the conjunctiva is what we call cluster, Stimson's line class. So again, these are what we call your measles. Okay? So pag measles, letter M. Ano class ang letter M? Mukha. Tama? What about class your German measles? Your German measles will produce what we call class your what? Low-grade fever. Your German measles will produce what we call class your low-grade fever class na tinatawag. Okay? So that's why, which is much serious? Measles or German? Which is serious? Oh, let's go back. Measles. Which is mild? German, right? German is only dangerous to pregnant mother. So pregnant mother should not expose themselves to German measles, okay? Rashes is only 3 days. Why? The pattern of the rash is said to be confluent. The pattern of the rash is said to be confluent. When I say less confluent rashes, rashes appear together. When I say less confluent rashes, rashes appear together. So when I say less rashes appear together, that is what we call class your confluent rashes. Rashes appear together. There's also what we call class your maculopapular rashes. There's also what we call your maculopapular rashes last. No, so yon. So that's what we call class your maculopapular rashes. So rashes. Okay, there's also what we call your Forsheimer spots. What are Forsheimer spots? Forsheimer spots are rashes on the soft palate. Okay, so if you have the Koplik spots, where do you see Koplik spots? You see Koplik spots where? In the buccal mucosa, right? In the buccal mucosa. But what about last Forsheimer spots? How many percent of children, adults, who have German measles will have what we call cluster Forsheimer spots? How many percent? 20. 20%. But where do you see the rashes? The rashes are found in your soft palate. It is found that's where? In the soft palate. So you see that, okay, what you see as a rashes that's in the skin, you also see that inside the soft palate. What is the appearance of the rashes for your German measles? Pinkish or reddish? What is the appearance of the rashes? Pinkish or reddish? The appearance of the rashes are what we call pleasure pinkish. Pinkish. Discrete red or pinkish. You think of German. German are lighter in color. German are pinkish. Okay, so yon. So measles, Filipino. Filipino, reddish. If it is Filipino, it's reddish. If it is German, pinkish. Okay, so yon. So that's the difference. Both of them would have, can you see that? Both of them would have maculopapular rashes. It's just that if it is measles, it's quite reddish ang color. If it is what we call cluster German measles, the color is discrete red. If it is measles, you see what? Koplik spots in the buccal mucosa. If it is German measles, you see, it sounds German then, Forsheimer spots on the soft palate. But how many percent would only have Forsheimer spots? Only 20%. That's why it's not the pathognomonic sign. Okay? The pathognomonic sign for German measles is your lymphadenopathy. The pathognomonic sign is your lymphadenopathy. Lymphadenopathy means kulani. You have the lymphadenopathy. Where is the location of the lymphadenopathy? The location is post-occipital or post-auricular. There's what we call post-occipital and post-auricular. So that is the location of your, okay, of your lymphadenopathy. Okay? Lymphadenopathy, post-occipital, post-auricular. What about your chickenpox? For chickenpox, you have what we call your rashes. Where would the rash start if it is chickenpox? Where would the rash start if it is chickenpox? Mukha or katawan? The rashes would start sa katawan. So the rashes are said to be what we call what? Centrifugal. the rashes would said to be centrifugal. Because sa katawan siya mag-start, so sa katawan, and the pattern is going outward. So it would start last from the body, so you have more rashes on the trunk, and the pattern is going outward to the extremities. Okay? Now, how would the pattern proceed? The pattern class would start as a flat lesion, macule. So it's quite difficult to differentiate measles, German, and chickenpox on the early stage of the disease. Then after that, there will be what we call a pimple-like, okay, lesions. You call that as papule. And after papule class, you have what we call class your lesions class. You call that as your vesicles. You call that as your vesicles. So these vesicles contain fluid. Are they contagious? Yes, vesicles are contagious. Then it would form into a crust or scab. If it is already a crust or scab, it is already dry. Now question, how long siya usually class? No? So yon, usually class, it would take you like what? 1 week, no? It would take you class 1 week before siya class mag-dry. No? So yon, 1 week before siya class mag-dry. So ibig sabihin, okay, after 1 week, pag dry na siya, is it still contagious or not contagious? It's not contagious anymore. Kapag dry na siya, it is not contagious anymore. Okay, so that is the what characteristics of what we call as your okay chickenpox. So once it is dry, it is already non-infective. Once it is dry, it is already non-infective. Do you understand? Okay, so that is what we call as your measles, German measles, and chickenpox. So after 1 week, you can send the child back to the school because that's not contagious anymore. Let's proceed. Okay? Let's proceed, class. We have what we call class your what? We have what we call class your management. If it is viral, do we give antibiotic? No. Antibiotic does not work on viral infection. So the treatment is just supportive because the characteristic of the disease is self-limiting. When I say class self-limiting, it will just heal on its own. Kusa lang yon gagaling. It will just heal on its own. Kusa lang yon gagaling. Okay? So what you need is to strengthen, to boost your immune system. So don't forget to drink concepts. Concept boost your immune system. Okay? So yun. So you advise patient to rest, drink a lot of fluid, and if there is fever, what do you give? Very important in the exam. If there's fever, what do you give? Tylenol or aspirin? What do you give? Tylenol or aspirin? Tylenol. Tylenol. Why? If it is a child and it is a viral infection, if it is a child and it is a viral infection, no aspirin, please. If it is a child in a viral infection, no aspirins, please. Why? Because it can cause what we call class your adverse effect. And what is the adverse effect class? It can cause what we call class your Ray's syndrome. The adverse effect is that it can cause Ray's syndrome, whereby what happens last is that two major organs are damaged. What are the two organs that are damaged in Ray's syndrome? The brain and the liver. Are they vital? Are these vital organs? Yes. If you see symptoms of a child taking aspirin, having symptoms of your Ray's syndrome, is that priority? Is that priority, class? Of course, that's priority. The child may die. Diba? What do you want to do? You just what? You just go to the morgue? No. We will save the baby. Save the baby. Okay? So that's your... Ay, hindi mo intindihan kung may mali. Hindi ko din maintindihan yung sinasabi ko, you know? So we have your measles, German measles, and your chicken pox last, no? So do we have a vaccines for this? Yes or no? Yes, don't forget, they have what we call, they are all preventable. So we have what we call as your rubiola vaccines or measles vaccine. Tama? You have what we call as your rubella vaccine or German measles vaccine. Right? Okay, there's also what we call your MMR. So MMR is your measles, mumps, rubella. Now, in the NCLEX, they usually give it at 12 to 15 months. These are given to adult already. Ito, okay, MMR are what? MMR are 12 to 15 months. What is a common question? Why among all vaccines you need to give your MMR late? That's a common question. Why do you give MMR late last? Have you noticed most vaccines are given at birth, 2 months, 4 months, 6 months, but your MMR, okay, it's given late last. Okay, to make the vaccine more effective. Why? If you give it early, it's less effective. If you give it late, it's more effective. Why? Because your MMR, okay, so yon MMR vaccine class are live attenuated. Okay, so you need to wait class that the antibodies, okay, antibodies from the mother that was received by the baby intrautero would be decreased to make the vaccine more effective. Because antibodies from the mother, once we inject the vaccine, will make the vaccine less effective. We will wait that the antibodies from the mother would be gone or decreased to a low level before we inject MMR to make it more effective. Okay? Next, for rubella, and varicella or chickenpox. Okay, varicella or chickenpox. What is important last is that what? You give it what we call to adult, and what is important to us? Okay? Women. Okay? For women, no to pregnant mother. You don't give it to pregnant mother because that is teratogenic. So when is the best time to give this vaccine? When is the best time to give this vaccine? The best time to give this vaccine is during menstruation or right after menstruation. During menstruation or right after menstruation. Because we are sure that the mother is not pregnant. Because we are sure that the mother is not pregnant. Do you understand? Okay, so yon. So that's the principle for what we call your rubiola. And in the NCLEX examination, measles vaccine are not given. This is very important. They're not given for those class who were born before what? Look at this. So yon. So measles vaccine are not given for those who were born class before 1957. So look at this. If you are born before 1957, look at this. All adults who are born in 1957 or later should receive one dose of the vaccine. Unless if you are born below 1957. If you are born before 1957, hindi na po usually recommended yung ating vaccine. If you are born, okay, what we call class before 1957, most of these people are already immune. Okay, kumbaga you have what we call the natural immunity. Okay, so that's your measles, German measles, and chickenpox. Okay, now, another exanthemus disease, we have what we call class your scarlet fever. Your scarlet fever, okay, is what? Measles, German measles, chickenpox, all of them are viral. But for scarlet fever, it is what we call class your what? Bacterial. Scarlet fever is what we call class your what? Bacterial. The cause of the bacteria is GABS. Question, can you cohort your scarlet fever with sore throat? Can you cohort your scarlet fever with sore throat? Yes, because they have the same causative agent. So the causative agent is GABS class. Okay, GABS. And take note, okay, is this related to rheumatic heart disease and acute glomerulonephritis? Is that disease related to rheumatic heart disease and acute glomerulonephritis? Yes. So those are complications to watch out. Part din siya ng Spider-Man. The letter S in Spider-Man is what? Scarlet fever. So scarlet fever would produce what symptoms? It would produce a high fever. Now, why high? Because all disease that has a fever at the end will produce high fever. High fever is a fever that is more than 40 degrees. High fever is a fever that's more than 40 degrees centigrade. Okay? So, if it is more than 42 already, you call the doctor, the child will be prone to seizure. There's also what we call class your sore throat na tinatawag. There's also what we call class your sore throat. There's what we call class your tonsillitis. Tonsillitis. There's also an enlarged cervical lymph node. Enlarged cervical lymph nodes. Okay? Now, characteristic rashes is what we call your reddish orange. Because when you talk about what we call the scarlet, scarlet is a color. It is a color whereby the color is reddish orange class. Okay, and when you talk about class what? Your scarlet fever, it is what we call class what? Sandpaper-like rash. The appearance of the rash for scarlet is sandpaper-like rash. Now, it is rough, magaspang. Okay? And the characteristic pattern is that it is ano siya? It is what we call cluster centripetal. When I say cluster centripetal, you can see most of the rashes on the covered areas. Unlike in chickenpox, it's centrifugal. Another important characteristic is your past chest line, no? Okay, what is past chest line? Past chest line are what we call as what? Hyperpigmentation on your skin folds. When I say class hyperpigmentation on the skin folds, you call that as what we call class your past chest line. Let's check. So past chest line are what we call class your what? Hyperpigmentation on the skin folds. Kilikili, kilikili. Okay, okay, kilikili, kilikili. Parang may kanta na ganun. Di ba? Kilikili, kilikili. Okay, okay, singit, singit. Okay, at puwet, puwet. Okay, no, so yun. Kilikili, kilikili. Okay na, so yun. Nangingitim. Tama? Pag may itim na, lalo siya mangingitim. Tama? No, so yun. So that's what we call as your what? Ano tawag? Past chest line. Scarlet. So you think of the color. Yung color na reddish orange, yung color nangingitim. Pag reddish orange, ang tawag scarlet. Kapag nangingitim, ang tawag ay past chest line. Sa kilikili, singit, at sa puwet. Tama? Now, you also have what we call strawberry tongue. That is the pathognomonic sign. The pathognomonic sign is your what? Scarlet, you think of letter S. Scarlet is strawberry tongue. Letter S. Now, why? The strawberry tongue is whitish and reddish. That is trying to differentiate it with your Kawasaki disease. Because Kawasaki disease also has your strawberry tongue. The characteristic lesion is whitish, then it becomes reddish. Whitish, then it becomes reddish. You call that as what we call as what? What do you call that? You call that as your strawberry tongue class na tinatawag. So in strawberry tongue, okay, it start muna as a whitish strawberry tongue. So you see bumps there. Then after that, it becomes a reddish strawberry tongue. Then you see bumps. Bumps are inflamed papilla. So those inflamed papilla, okay, looks like an strawberry. Diba? Strawberry has a lot of bumps. Okay, that's why it's called a short strawberry tongue. Okay? So again, what are important symptoms in your patient with scarlet fever class? What are important symptoms in patient with scarlet fever? Again, what do you call that? Okay, anong tawag mo doon sa nangingitim na rashes sa scarlet fever? Past chest line. What do you call that pattern of your strawberry tongue for scarlet fever? Whitish to red strawberry tongue. Okay, so that is unique for scarlet fever. Scarlet fever, bacterial or viral? Scarlet fever, bacterial or viral? Okay, bacterial. Scarlet fever. Okay, is it what? Scarlet fever, is it droplet or airborne? Droplet or airborne? Droplet class, no? So how can we diagnose your scarlet fever? To diagnose your scarlet fever, we have your throat culture. So throat culture, you'll be able to have what we call class your GABs. But we have a rapid streptococcal test for scarlet fever. Okay, you have what we call class what? What are the diagnostic tests available? If you want class to have a rapid test, okay, so we have a rapid antigen detection test. That rapid test, if you are positive, you can already start your antibiotic. But if you are negative, then the doctor still suspect that you are positive because of the other clinical symptoms. Then you can submit it for throat culture. throat culture is considered as confirmatory. So if you're asked, what is the initial test or screening test for scarlet? What's the answer? What's the initial or screening test for scarlet? Correct answer is rapid antigen detection test. What is the confirmatory test for scarlet? What is the confirmatory test for scarlet? It's throat culture. Okay? So you just need to differentiate what is being asked in the exam. Okay? So again, so we have what we call class for what? We have what we call class for scarlet. We have what we call your rapid antigen test. Okay? So yon. Rapid antigen test for what we call class your scarlet fever. Ayan. So let's try to check class for rapid tests. So most of them are for COVID and not for scar. Okay, so yon. Most of them are for COVID and not for what we call class your scarlet fever class. So yon. So most of them are for COVID, no? You don't have, okay, yan. Uh, So actually, the pattern is still the same. Eh, no? So yun, you have that kit. If you are positive, then basically, class, you have those two lines. So if you have these two lines, class, that's all. It's the same with your COVID. No? So yun, how would you know the positive? If the control line and the test line are positive, you have those straight line, it's positive. If only the control line is having that straight line and the test line does not have the what line, then that is negative. Okay? So same lang din yan sa rapid. We call that sa rapid streptococcal test. Okay? So the confirmatory is your throat culture. Management, bacterial. So the drug of choice is penicillin. Okay? So penicillin. Once you start the treatment, you need to finish. Once you start the treatment, you need to finish it. Okay? So that's scarlet fever. Let's proceed to the next disease. The next disease is known as what we call cluster fifth disease. Did you remember fifth disease? Fifth disease is caused by parvovirus B19. It is the one class that causes what? What do you call that? Slap cheek appearance. It will produce what we call pleasure slap cheek appearance. Now, when you talk about what we call pleasure fifth disease, the other name for fifth disease is your erythema infectiosum. The other name is what we call your erythema infectiosum. So what is the causative agent? The causative agent is what we call Pastor parvovirus B19. The causative agent is parvovirus B19. Next, the mode of transmission. The mode of transmission is via droplet. The mode of transmission is via droplet class na tinatawag. So when you talk about class droplet, that is during the prodromal stage. During the prodromal stage class, the patient class would have what we call class what? Contagious. And during the acute stage, the patient is not contagious. Very important. This is unique in fifth disease. Most of diseases during acute are contagious. But in droplet, okay, during what we call class what, the patient class is not contagious class na tinatawag class. No? So yon. So that is what we call class your acute stage. Incubation period, 5 to 15 days. Incubation period, 5 to 15 days. Symptoms. Again, you will have flu-like symptoms just like other disease like measles, German measles, and chickenpox. Flu-like symptoms like nanghihina ka, you have body malaise, you have joint pain, some of them have diarrhea. Now, but what are unique symptoms for patient class with your fifth disease? There is what we call class your slap cheek appearance. So you have this group of rashes surrounding your face here in the area, in the cheek side. So that's why you have that slap cheek appearance. Question, symmetrical or asymmetrical? Symmetrical or asymmetrical? Symmetrical. So that's why both right and left, okay? Symmetrical. Next, in the surrounding your what? Surrounding your mouth, there's what we call pamumutla dito surrounding your lips. Okay, there's paleness surrounding your lips. you call that as a circummural pallor. So paka ng sinampal, sumumutla ka dito, tama, sumukha ka ng dal. And there's what we call class your characteristic symmetrical din na lace-like rashes. So that is the characteristic ha. What is the rash for Lyme disease? What is the rash for Lyme disease? Bullseye rash for Lyme disease. What is the rash class for your scarlet fever? For scarlet fever, you have what we call class what? Lace-like rashes. So basically, as lace-like rashes, you have here what we call rashes, but you have what we call class clear ang center. Clear ang, ay, hindi yan. Okay, so ang itsura ng rashes ay bilog siya, tapos clear ang gitna. So itsura nito ay ganito. Okay, so you have these rashes, but the center are clear. You have these rashes, but the center are clear. So you call that as what we call class your lace-like rashes. Okay, so let's try to check, no? Okay, so check the appearance of what we call your fifth disease. So fifth disease, lace-like rash. Fifth disease, lace-like rash. So, yan. So, this is what we call your lace-like pattern of rash. As you would notice, the center is clear. The center is clear. Okay, so that's your rashes. That's your slap cheek appearance. Again, when is the patient contagious? The patient is contagious during the prodromal stage. So can the patient return to school if there's already a slap cheek appearance? The answer is yes, because the child is not contagious and the disease is mild. Okay? The disease is mild. Management is supportive. You just manage, the symptoms. Again, this is viral. This is common among children. This is viral. What medication is not allowed? Aspirin. No, the medication is not allowed. It's your aspirin, right? Okay, so you don't give aspirin class na tinatawag because why? It can cause what syndrome? Ray's syndrome. It can cause what syndrome? Ray's syndrome. Do you understand? So that's what we call class what? Your fifth disease class. Now let's proceed to what we call class what? Lyme disease. So for Lyme disease, so this will be the last after this will be having your what? After this you'll be having your post test. Okay? So stay with me and after that we'll have our post test. Okay? So, last disease. We have what we call cluster Lyme disease. Lyme disease is caused class by what? It is caused class by a bacteria known as what we call what? Borrelia burgdorferi. The name of the bacteria is what we call class your Borrelia burgdorferi. So this bacteria is caused class by what we call class a spirochete. So this bacteria is caused class by spirochete or it is a spiral-shaped bacteria. Okay, spiral-shaped bacteria. Now, so this bacteria, so any disease, na cause is spirochete, same with your syphilis, would damage two vital organs, the brain and the heart. Think of this. Syphilis is STD. Lyme, associated sa honeymoon, may Lyme. Tapos, tahimik lang sa umpisa. Tapos, time, tequila! Okay, so yon. So the brain and the heart. Diba? So sa love life yun, sino ang pipiliin ko? Okay, diba? So yon, mahal ko o mahal ako. Tama na, so yon. Diba? So yung brain mo ba? Okay, o yung heart mo yung susundin mo. Tama na, so yon. Tama? So brain and heart. Unlike in Ray's syndrome, you have heart, brain, and liver. Ayaw sila sa brain eh. Kaya lang sa Ray's is liver. Okay, kasi when you go to Ray's barbecue, have you tried eating at Ray's barbecue? Di ba yellow yung rice? O yellow yung rice sa Ray's barbecue, liver, jaundice, di ba yellow? Okay, so ito naman, syphilis, Lyme disease, brain, and heart ang complication. A common question in the exam, what type of precaution should you apply for a patient diagnosed with Lyme disease? What type of precaution? That's a common question in your examination. Standard, contact, airborne, droplet. What is the common precaution that you apply? Standard precaution only. because that is not contagious. Tama? Now, mode of transmission, vector, deer, tick. Okay, kinagat ka ng black-legged tick. Okay, so yon. Kinagat ka ng black-legged tick. Okay, so in short, so what is the vector? The carrier is the tick. So question, if you're bitten by the deer, can you have Lyme disease? If you've been bitten by a deer, can you have Lyme disease? No. Hindi naman siya sa deer eh. Nasa tick siya, kagat ng garapata. Tama? So kagat ng garapata. It's the insect that carries the bacteria. Incubation period is 3 to 30 days. Incubation period is 3 to 30 days last. And you have this characteristic rash. What do you call this rash? Bullseye rash. Now, in your bullseye rash, okay, so what is the appearance? No? When you play for dartboard, tama, no, so yon, you have what we call class your bullseye rash. That's characteristic. Let's describe it. One of the earliest signs is your bullseye rash. It begins as a reddened area, and the rash will increase in size and clears in the middle. Okay, it will increase in size and clear in the middle. Pero isang bilog lang siya. Ayan. So that is the characteristic bullseye rash. Actually, may iba't ibang itsura yan, So, ng inyong bullseye rash. Pero basta may isang malaking bilog. So this is usually seen class where? This is usually seen sa mga pag nagaling ka sa camping. Tama? So yon. So you have this characteristic rash. You call that as your bullseye rash. Or the other term is erythema migrans. Why is it called as erythema migrans? It's migrating. Lumalaki siya. It's migrating class. No? So yon. You have this characteristic what? Flu-like signs and symptoms. You have this characteristic what? Flu-like signs and symptoms. So, ibig sabihin, you have what we call as your symptoms of your fever, your headache, your body malaise, tama, and arthritis class. No? So, yon. So, fever, headache, body malaise, arthritis. So, again, that is what we call class your what? Your flu-like signs and symptoms. Your flu-like signs and symptoms last. Then months after the bite, this is where complications would set in. So in short, you will not die of Lyme disease right away. You would only die a few months after, when it would already attack the brain, encephalopathy, okay, would attack the heart, carditis, aortitis, and nerve, causing nerve palsy, which lead to facial palsy and hearing loss. So these are signs that there is already a complication. Okay, so in short, you will not die during the acute stage, you will die a few months after. Okay, so now, what is your diagnostic test? Diagnostic test for Lyme disease is your serological test. Don't forget, if it is a serological test, it is a test that would check for the presence of antibodies. It is a test that would check for the presence of antibodies. Because we all know that once you are exposed to antigen, the body, the immune system will create antibodies, right? Right. So if the immune system will create antibodies, ang tanga-tanga lang. Ang tanga tong lecture na to. Okay. Ginikising ko lang sarili ko. So, yun. So we have what we call class your AIA. What is AIA? Enzyme Immunosorbent Assay. That's the new name of ELISA. Wow! That's the new name of ELISA. So this is a presumptive test. Pag nag-positive ka, so if you get positive with your ELISA, then you have what we call Western blot. So Western blot is confirmatory, just like HIV, right? Because Western blot assess for the presence of specific antibodies. It would check for the what? Symptoms of specific antibodies last. Okay? Now, what is the management for patients last with your what? With your, what's the management for patient last with your, Lyme disease? DAC. So when I say class your DAC, what is DAC? Doxycycline, amoxicillin, and cefuroxime. Doxycycline, amoxicillin, and cefuroxime. So that is your management last. Okay? So You only give Sepuro, oh, this is also asked in the exam, Sepuroxime. You use this if there's already CNS symptoms. What are CNS symptoms? As there, uh, 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 facial palsy, right? There's facial palsy, nerve paralysis, then you use cefuroxime. But if there is no facial palsy, you can use the standard antibiotic. Okay, the standard doxycycline, amoxicillin, right? So standard. But if it is CNS involved, cefuroxime. So, how can you prevent your Lyme disease? To prevent Lyme disease, so usually you acquire it when you go to the forest. So, in the exam, the keyword here, history of going to camping. Hmm, Lyme disease. Or pwede din, you have this rash, history going to camping, may rashes, pwede din measles. But you need to differentiate the difference of your measles and your Lyme disease. So you need to check what is presented. Kasi pareho yan in the NCLEX. You have case study for Lyme disease, you have case study for measles. Both of them came from camping. Okay, but you need to know, this is the characteristic of measles. This is the characteristic of Lyme disease. Di ako maloko. Okay, so yun. So avoid going to the forest. Number 2, it is usually transmitted by tick bite. So you wear protective clothing. When I say protective clothing, long sleeve, long pants, socks, medyas, socks. Okay, so yon. Then you have to wear your shoes. And very important, the lower end of the pants should be tucked in your socks. The lower end of pants, no? So yon, should be tucked in your socks last na tinatawag. So when I say class, the lower end of the socks, okay, is tucked in your pants, that will prevent the tick from entering. Tama, no? So, yon, ha? So, that is what we call, yan, di ba? Para ka din si McDo, di ba? So, yon, si Ronald McDonald. Tama, no? So, yon. Okay, so si Ronald McDonald, hindi yan magkakaano. Okay, hindi yan siya class magkakaroon ng Lyme disease because the lower end of the pants have what we call class what? Is tucked di ba? Hindi talaga si Macdo talaga naka-long sleeve long pants. Tapos ano siya? Light colored clothing or dark colored clothing? Light colored clothing. Light colored clothing so that you can see the tick if it attached in your clothing. Okay? Now, you use what we call class your insect repellent. Yes, when I say class insect repellent, okay, is your tick an insect? Yes or no? Yes, it's an insect. So most likely, your off lotion is also effective. Question, what is the action of off against mosquito and your tick? What is the action of off against your mosquito and your tick? It will mask the odor of human. It will mask the odor of human. Hindi na tayo nila naaamoy. Do you understand that? So it will mask the odor of human. So ibig sabihin, hindi na nila tayo class makikilala. Alam mo yon, tama? So yon. So it will mask the odor of human. Hindi nila alam tayo yun. Nagigets nyo? So yon. So again ha, so we have what we call, anong nangyari dito? Saglit lang. They would not know that we are human. That's the action of what we call, sandali muna, naging aso na ako, oh my God. Okay, book smart, tulo. Sandali muna, wag mo na kayo chat ng chat kasi yung mukha ko pipindot ako pipindot. Sandali para mabalik ako sa normal. Okay, my God. Okay, so yon, mabalik ako sa normal class. No? So yon, where am I? No, my God, paano ako makabalik sa normal? Oh my God. God. Yeah, I'm back. I'm now a human. Ngayon, so now, okay, you have what we call class your from removal of your tick. When I say class from removal of the tick, what do you use to remove the tick? What do you use to remove the tick? Do you use class what we call class your credit card or tweezer? Tweezer, nakalagay na dyan, oh. Nakalagay class tweezer. Chani. Tama, so yon. You use tweezer, not credit card because that is not beasting. That's not beasting. So you use your tweezer. Question, how many hours after tick bite, okay, will you develop class what we call class your Lyme disease? How many hours after tick bite will you develop class what we call class your Lyme disease? The correct answer is, okay, so we will check for the CDC. Because in the exam, they will check for the CDC class. Okay, so yon. Okay, so how many hours, okay, should you have what we call class your Lyme disease? Okay, how many hours? Hours. Okay, so yon. Of tick bite. Check that. In most cases, okay, a tick must be attached 36 to 48 hours before you can transmit your Lyme disease. In short, if you already reach home and the tick is class is attached to your skin, can you still prevent Lyme disease? Yes or no? Yes, you can still prevent Lyme disease, right? Okay, and commonly, what transmit Lyme disease is not the what? What transmit the Lyme disease is not the tick. It's the nymph. The nymph are much smaller, so that's why it's the nymph class that usually hides, no? Wherein hindi natin sila napapansin, they are attached in our skin, lalo kapag hairy ka. Sino dito sino hairy? Meron ba dito? Pangalan niya si Harry? Harry Potter? Harry Potter? Okay, so yon. So nymph class. Okay, so yon. So you have what we call class the nymph. Usually is the one that transmit. Is the baby tick. Okay, so yon. So anong pinakaiba ng lamok at taka ng tick? Ang lamok, kapag kinagat ka, titikman ka lang. At lilipat sa iba, titikim naman sa iba. Samantalang ang tick, kapag kinagat ka, tinikman ka, didikit at didikit sa iyo yan ng ilang araw. Tama? So that's why kung kayo class magpapakagat, kanino kayo magpapakagat? Sa lamok o sa tick? Kanino kayo class magpapakagat? Sa loya. Sa loyal, no? So yan. So how to remove class what we call cluster tick? Okay, to remove tick, okay, so tingnan natin, removal of tick. Okay, the proper way to remove the tick. The proper way to remove the tick. Use a clean, fine tip tweezer to grasp the tick as close to the skin. So you grasp the tick as close to the skin. Question, do you grasp the tick class here, class sa puwet niya? Do you grasp the tick in this area? No. You don't grasp the tick in this area because pag na-pull mo to, matatanggal yung ulo niya, maiwan yung ulo niya. Aray, yung katawan ko. Ginawa pa siyang manananggal. So you grasp it as close as possible to the skin. Okay, to make sure that once I pull it out last, kasama yung pati yung kanyang bunganga. Kasama yung kanyang bunganga, class, no? So yon. So you have here what we call class what? As close to the skin surface as possible. Okay? So yon. Next, okay. Next, pull upward with steady, even pressure. In short, you pull, you do not twist. Okay? It's wrong to twist. You don't twist, lick, and dunk. That's Oreo. Tama, no? So yun. But rather, you pull straight traction. It's just like getting a white hair. You use puting buhok. Diba? So yun. Okay? After removing the tick, clean the area with your hands, rubbing alcohol because it's a bacterial. Okay, soap and water because it's a bacterial. Never crush the tick with your fingers. Kung uwatin kita na daliri, kung malandi ka. Hindi yon. Sa mga kabit lang yon. Sa mga kabit. But here, you don't do that. You place the tick class in alam mo yung yung ziplock? Pag Pilipino, may ziplock talaga yun sa Amerika. Lalo kapag may birthday, di ba? Okay, birthday ng anak ko. Tama ba? Pag Pilipino, sa bag niya, kahit na Louis Vuitton, may ziplock yan. Tama, di ba? So yun. So class, never crush a tick with your fingers. You bring it to the hospital. Once you bring the patient to the hospital, you bring together class the tick. Okay, so isama mo yung tick. Halika dito. dikit-dikit ka sa akin, halika sumama ka sa akin sa ospital. Tama? So nakalagay siya sa ziplock, sama mo siya sa ospital. Kasi ina-identify ng doktor yan. Okay? So yun. So that's how you remove class, the tick class na tinatawag. Okay? So again, ayan, save the tick class. No? So yun. Or you can flush it in the toilet bowl. No. You don't flush it in the toilet bowl. Pala, not allowed. Not allowed. Ang pina-flush sa toilet bowl, fentanyl patch yun. You don't flush this in the toilet bowl kasi makakalaya siya dyan. Yung iba, tumidikit lang dyan sa ceramic. Di ba? Yung sa tubig, di ba pa nag-flush? So, yun. So, pwede siya mabuhay pa rin kasi tick yun, didikit lang yun sa ceramic. Yung anak mo, hagatin ko yan. Pinong-pino kong kagatin yan. No? So, yun. So, class, you don't flush the tick in the toilet bowl. You place it in a container, seal it, or you can place it in the Ziploc, class. Okay? There is a vaccine before for Lyme disease, but now, it's not obsolete. Hindi na tayo, class, gumagamit, class, ng vaccines, class. Okay? So, that's what we call, class, ang tawag, Lyme disease class na tinatawag. Okay? So again, so those are common now in the examination. Okay? So class, don't forget class Don't forget, okay, this is it In your examination, do not forget class na, okay, ano tawag dito? To enter in the final coaching. Because in the final coaching, this is where class the good part happens. Okay, so yon. Because in the final coaching, doon class nakikita yung mga trends natin, yung mga feedback ng student, at saka yung mga high yield questions. Okay Okay, so you can chat. Pero usually gabi na ako nakaka-reply talaga dahil tuloy-tuloy yung pasok ko. Pero, okay, pag may ATT ka na, pwede ka mag-ask you can ask me kung kailan yung best time sa'yo, kailan ba usually yung final coaching, kailan ako papasok, ano mga nangyayari. Kasama na yun sa bayad mo. Okay kasama na yan sa bayad. So, ayoko lang, may estudyante kasi minsan pumasa na siya. Bakit di ka pumasok na final coaching? Akala ko sir may bayad. Wala na yung bayad yun. Yung one-on-one, wala ding bayad yun. But you need to go to the final coaching first before you undergo the one-on-one assessment. Okay Before you go to the one-on-one assessment. Okay? Klaro? So now, it's time for your post-test. Now, ang rationalization sa recorded file na lang. Okay, so sa recorded file, dun ko ibibigay yung ratio sa recorded file na to. Okay? So, Sir Lawrence, andyan na po yung kwan.
Yes, sir. Nakapost na po yung post-test, sir.
Okay, nakapost na po yung post-test. You answer now the post-test. Tapos yung rationalization is a recorded file. Okay? Ay, sige. Okay, so siya. Ay, Sir Lawrence, mag-out muna ako. Doon ako sa panggabi, sir, mag-record ng ratio, sir.
Sige po, sir. Okay po.
Okay, siya. Ikaw na bahala sa kanila, sir, ha?
Opo.
Ingat.
Thank you, nurses. Announcement, nurses. Tomorrow, our class is PIDYA by Sir Daklis. And don't forget to evaluate the lecturer po. And if ever po na may concern and clarification po, kindly form lang po dun sa form na sinesend po namin sa GC. So, thank you, nurses. See you tomorrow po. Bye-bye po.
Answer kayo, ha? Pansya mo sila, sir, ha?
Opo.
Okay, sige.
Thank
Ako
you,
pa rin
nurses.
pala
Thank you.
bukas.
Opo.
Bye! See you tomorrow! May pedya
Bye
tayo!